what contingency plans there are if there is a mutation that proves resistant to either of these vaccines, and we have to be in these measures for longer. And will he consider, in particular, we have drawn barely on the numerous people in the armed forces to create extra NHS capacity. We could do so much more of that if necessary. Is that part of the plan?
Yes, it's very much part of the plan. It's happening right now. Now, on the question of mutations and the link to the virus, to the vaccine, of course, as with flu mutations mean that we have to change the vaccine each year for flu. And we may have to update any vaccine in the future, but that is not our understanding of the situation now. And of course, that's being double-checked and tested, both with the scientists in Porton Down and as we roll out the vaccine in areas where there is a high degree of the new variant. With the pharmacological surveillance of those who have been vaccinated, we will be able to see for real the impact of this vaccine on the new variant. And the goal is, as my right honourable friend said, that by the middle of next month, we plan to have offered the first dose to everyone in the top 4 priority groups, and they currently account for 4 out of 5 COVID fatalities. And I'm not sure this is a point that has fully been addressed, which is that because of the strong correlation between age and fatality from COVID, sadly, it means that we will be able to vaccinate those groups that account for 4 out of every 5 fatalities within the top 4 cohorts. Now, it does then take 2 to 3 weeks from the first dose to reach immunity. But the vaccine, therefore, is the way out of this pandemic, and it's the way to a better year ahead. Yes, absolutely. And then I do want to make some progress on the detail of the regulation.
I'm grateful it was on that specific point that he raised, and he knows obviously that I understand that point because it's exactly the point that I raised with him last week in the House when we recorded last week, and I welcome the Prime Minister's commitment to it. But can I just take him back to the question from my honourable friend, the member for Winchester, because it's this point. He's very clear. Once we've vaccinated those 4 groups and they've got immunity and we've taken care, therefore, of 80% of the risk of death, what possible reason is there at that point for not rapidly relaxing the restrictions that are in place on the rest of our country?
We have to see the impact of that vaccination on the reduction in the number of deaths, which I very much hope that we will see at that point. And so that is why we will take an evidence-led move down through the tiers. When we've broken the link, I hope, between cases and hospitalisations and deaths, we will need to see those numbers we will need to see the protection in reality, in lived reality on the ground, but we will watch this like a hawk. And my aim is to keep these restrictions in place not a moment longer than they're necessary. I'll give way on that point.
Secretary Stone, thank him for everything he is doing. But the logic of him anticipating what's going to happen in 2 or 3 or 4 weeks' time, from the number of cases we're getting at the moment, is that we can do the same in reverse. That is to say, when we have sufficient number of people vaccinated up, we can anticipate in 2 or 3 or 4 weeks' time how many deaths have been avoided. That means, since it cuts both ways, he will be able to make a decision on when we should end these restrictions, as my right honourable friend has just suggested.
The logic of the case that my honourable friend makes is the right logic, and we want to see that happen in empirical evidence on the ground. And Madam Deputy Speaker, this hope for the weeks ahead doesn't take away, though, from the serious and immediate threat posed now. And I just want to turn to what is in the regulations and the actions that we need to take. The Office for National Statistics has reported that 1 in 50 of the population has the disease, some with symptoms, some without. The latest figures show that we have 30,074 COVID patients in UK hospitals, and that the NHS is under significant pressure. Admissions are now higher than at any point in the pandemic. And so on Monday, all 4 UK chief medical officers recommended we move the country to COVID-19 alert level 5. In practice, this means they believe that without action, there is a material risk of healthcare services being overwhelmed. It's for this reason that we've placed England into a national lockdown, alongside action taken in each of the devolved nations. And every single citizen needs to take steps to control this new variant. And this personal responsibility is important. And to give the NHS a fighting chance to do its vital work of saving lives, it is on all of us to support them. These regulations set out that everyone must stay at home, save for a limited number of reasons permitted in law, including essential shopping, work if you cannot reasonably do so from home, education or childcare if eligible to attend, medical needs including getting a COVID test or getting vaccinated, exercise, escaping domestic abuse, and for support bubbles where people are eligible. These regulations are based on the existing Tier 4 regulations with some additional measures which reinforce the stay-at-home imperative. These include stopping the sale of alcohol through takeaway or click and collect services and closing sport and leisure facilities, although allowing playgrounds and allotments to remain open. Now, I know that these further restrictions are difficult, but they are unfortunately necessary because we have to absolutely minimise social interaction to try to get this virus back under control. And these measures came into force first thing this morning under the emergency procedure and will remain in force subject to this House approval today. Yes, of course.
I've just been talking to my right honourable friend from North Somerset, a doctor. He showed me the ridiculous form he's had to fill in to make this simple jab. You know, diversity, equality training. When he's inoculating an old lady, he's not going to ask her if she's come into contact with jihadists or whatever. So the Secretary says he's got to cut through all this bureaucratic rubbish.
I'm a man after my right honourable friend's heart. And I can tell the House that we have removed a series of the unnecessary training modules that have been put in place, including fire safety, terrorism, and others. And I'll write him with the full panoply of the training that is not required, and we have been able to remove, and we made this change as of this morning, and I'm glad to say it's enforced. Now, I'm a fan of busting bureaucracy, and in this case, I agree with him that it is not necessary to undertake anti-terrorism training in order to inject vaccines. Yeah.
I notice also a story about not delivering vaccines on Sunday, which, as I understand it, they think there will be sufficient vaccines for them to do 7-day inoculation. If somebody runs short, they will get topped up, yes, which is a little different from what the Telegraph said today.
He's quite right. The supply of vaccines can take place on all 7 days of the week. But in a regular way, we do it on 6 days of the week, and then on the 7th day, people can either rest or deliver further vaccine if that's what's necessary. And as a result of this, there has been no point at which somebody in any area has been short of vaccine because of this delivery schedule. We have a challenge, which is we need to increase the amount of vaccine available. And the current rate limiting factor on the vaccine rollout is the supply of approved, tested, safe vaccine. And we are working with both AstraZeneca and Pfizer to increase that supply as fast as possible, and they're doing a brilliant job. But that is the current rate limiting step. Now, as that supply increases, Madam Deputy Speaker, we are going to need more people to vaccinate. We're going to need to get the pharmacists involved in vaccination. I very much hope to get my honourable friend, a former doctor, involved in vaccination, and others. We will need more people, but the current rate limiting factor is the supply of vaccine. That isn't to say that the companies aren't supplying on the schedule that is agreed. They are, and they are doing their bit. But we do need to increase that supply, and then the NHS will increase its delivery. And I hope to make absolutely crystal clear that point, because the the PHE work to get the vaccine out, that is not a rate-limiting step. The current discussions we're having with the pharmacists, that is not a rate-limiting factor. What is the rate-limiting factor is and the fill and finish isn't a rate-limiting factor. What's a rate-limiting factor is the amount of the actual juice available, the actual vaccine, which is not manufactured like a chemical. It is effectively it is a biological product. It's a bit like if you bake your own bread, Madam Deputy Speaker. I don't know if you do, but I sometimes do. And it is a bit like the creation of and growth of yeast. That's probably, it's probably the best way to think of it. It is a complicated and difficult task, and it is, and that is the rate-limiting factor. And I pay tribute to those who are engaged in the manufacturing process of this critical product. Yes, of course.
Tiny one. He knows I'm obsessed with this. He mentioned the agreed schedule of delivery. Will he consider publishing that so that we can see what the agreed schedule is?
Well, what I can assure my honourable friend is that agreed schedule of delivery will enable us to offer vaccinations to everybody in the top 4 priority groups by the middle of February, and that's why the Prime Minister could commit us to this delivery schedule. I just want to turn just for a moment to the support that has been outlined, because we're providing an additional 4.6 billion of support to businesses, including those in retail, hospitality and leisure, who've been forced to close their doors once again, on top of course, the £280 billion plan for jobs, which includes the extension of the furlough scheme until April. And I'll give way.
I'll be brief. I don't want to try Madam Deputy Speaker's patience. Just on that point that my honourable friend raised, the reason why he raised it is we had a fantastic call last week, early this week, with Nadeem, with the Minister for Vaccine Delivery. And we asked this question a number of times about the agreed schedule, and we didn't get a clear answer. So it's been agreed with the companies. Why can't he just publish it so that we know when vaccine's going to arrive, and it will give people the confidence that we're going to deliver on the Prime Minister's commitment to the country?
Well, I'll happily take that point away. But what I can tell my right honourable friend is that supply does allow for the delivery of the schedule and the target that the Prime Minister has set, which that my whole team is working to. Madam Deputy Speaker, yes, of course.
Thank the Minister for giving way, and he stressed that the problem is really in production of the vaccine. Presumably there's a limited number of sites on which it's done. Why haven't we expanded the number of sites?
We spent the summer working on that, and I know that the vaccine has sprung into prominence in the public debate over the past month or so, but we have, of course, we've been working on that through the whole of last year, and there's further expansion still to come. I'm glad to be able to assure him. Madam Deputy Speaker, I will close now just by reiterating that if we don't act now, we know that eventually the NHS would not be able to cope, and I know that no member of this House wants to see scenes that have been witnessed elsewhere in the world of hospitals overrun or doctors forced to make the choice of who to treat and who to turn away. And we know that while the winter weeks will be difficult, we now know what the way out looks like. And accelerating the deployment of COVID vaccines, making the most vulnerable groups safe, and everyone playing their part on the way to get us there. That is the route out of this pandemic. Now I'll take a final intervention from my honourable friend.
I thank the Secretary of State for everything he's done for this, and would he also join me in thanking the residents of Wolverhampton for the community testing that they've done, especially Bilal Mosque and Sedgley Street, Gurdwara, where they've all come together to defeat this virus?
Yes, I will. And Madam Deputy Speaker, I'm very glad that I took that final intervention, because the people of Wolverhampton have come together to deliver community testing in an incredibly impressive way. And I've heard about the work of the Gurdwara, bringing together faith leaders of all different faiths to make sure that we get testing out into the community. And we need to do the same with the vaccine programme, as well as testing. Both of these are absolutely critical. And in the meantime, Madam Deputy Speaker, we must stay at home, protect the NHS and save lives, and that eventually will carry us to a brighter future.
Thank you. The question is motion number 3 relating to public health as on the order paper. And just before I call the right honourable gentleman, I confirm that there will be a time limit of 3 minutes imposed immediately upon backbench speeches. Jonathan Ashworth.
Thank you, Madam Deputy Speaker. We will support these public health regulations tonight, but like the Secretary of State, I did not come into politics to restrict people's freedoms like this. And as somebody who represents the city of Leicester, a city that has effectively been in a form of restriction since last March, I well understand the devastating impact restrictions can have on our economy, on our way of life, on the mental health and well-being of our constituents. Indeed, many of our constituents will be devastated at the prospect of weeks and weeks, possibly more until the end of March, possibly, in isolation, feeling anxious, feeling lonely. Last year, in the months following the long lockdown, 19.6 million antidepressants were prescribed, a 4% increase on the same period in the year before. More than 6 million people in England, the highest on record. So, if we are to support lockdown, we need assurances from ministers that mental health services will be fully resourced, will stay open, and will be able to respond to people's needs throughout this lockdown. I know that many people find solace through prayer, so I'm grateful that communal prayer can continue through the lockdown. And can I just, with the indulgence of the House, take this opportunity to thank Leicester City Council, Peter Salisbury, and our councillors, especially those for Stonygate, Wycliffe and Spinney wards, who have all worked so hard with our many mosques, temples, gurdwaras, synagogues and churches across Leicester on ensuring COVID-secure worship.
On that point today.
Yes, of course.
I think it's really important, Shadow Minister, to have prayer. Would the Shadow agree and call, as I have in the past and others have passed, for a day of prayer, a national day of prayer for this country?
I think that is a very good recommendation. And can I extend an invitation to the honourable gentleman to return to Leicester to watch our great football team when we are allowed and out of this lockdown, and perhaps I will take him around and show him some of the great interfaith work that we do in Leicester as well. This lockdown will also hugely impact the well-being of our children, so I plan to get our children back safely into school is a priority. There will be thousands of children out of school in overcrowded, cramped accommodation, unable to access learning properly from home. There will also be other children at risk of abuse and violence. Members might know I've spoken of my own experiences growing up in a home with a parent who had a problem with alcohol. Many children will be facing the prospect of being locked in their homes with a parent who abuses drink or drugs. So can I urge ministers to work with and fund those children's advocacy and support groups, such as the National Association for Children of Alcoholics, which I've worked with closely, who will be doing so much throughout this lockdown. But today, I agree with the Secretary of State. We do, unfortunately, have to restrict freedoms further in order to safeguard freedoms for the future and save lives. As the Secretary of State said, the tragic reality is the virus is out of control, and to be blunt about it, there is no freedom for our constituents if they are in the graveyard. There is little freedom also for those who suffer from the enduring debilitating effects of long COVID as well. Yesterday, almost 55,000 cases reported in England. 1 in 50, as the Secretary of State said, have the virus. Those in hospital numbers more than they did in April. Over 1,800 in intensive care. Yesterday, there were over 3,300 hospitalisations, a record, and admissions are going up in every region. This is a national emergency, and a national lockdown is necessary. Indeed, we should have locked down sooner. We are voting this lockdown through on 12th night, yet in the run-up to Christmas, the alarm bells should have been ringing. The Secretary of State came to the House on the 14th of December to report a new strain, now known as the B117 strain. He told the House then, initial analysis suggests that this variant is growing faster than the existing variants. The Prime Minister learned of the rapid spread of the new variant on the 18th of December. The NERVTAG group met that day and concluded the new strain added at least 0.4 to the R. On 21st of December, the Chief Scientific Advisor, Patrick Vallance, said the new strain was everywhere and cases would rise after the inevitable mixing at Christmas. The lesson I think you have to learn about this virus is that it's important to get ahead of it in terms of action. SAGE met on December 22nd, the following day, and concluded, "It is highly unlikely that measures with stringency and adherence in line with the measures in England in November would be sufficient to maintain R below 1 in the presence of the new variant." And here we are, 2 weeks later, with 500,000 infections since 22nd of December, 33,000 hospitalisations since 22nd of December. This is a national tragedy. And why is it this Prime Minister, with all the scientific expertise at his disposal, all the power to make a difference, always seems to be the last to grasp what is needed to happen? The Prime Minister hasn't been short of data, he has been short of judgment, and yet again we're all paying the price. But as the Secretary of State has said, there is light at the end of the tunnel. Vaccination is how we ultimately are released from these restrictions. And I want to pay tribute to all involved in helping distribute and administer 1.3 million vaccine doses so far. This is a great achievement, but we need to go further and faster. The Prime Minister has promised almost 14 million will be offered the vaccine by mid-Feb. That depends on around 2 million a week doses on average. Now, both he and the Prime Minister have reassured us in recent days that it's doable based on orders. But in the past, ministers have told us that they had agreements for 30 million AstraZeneca doses by September 2020 and 10 million of Pfizer doses by the end of 2020. So I think people just want to understand the figures and want clarity. Can ministers tell us how many of the ordered doses have been manufactured? How many of the ordered doses have been delivered to the NHS? And how many batches are awaiting clearance through the MRHA checking processes? 2 million a week would be fantastic, but it should be the limit of our ambitions. We should be aiming to scale up to 3, then 5 to 6 million jabs a week over the coming months. So, shouldn't be the limit. You're quite right. I misread. Thank you for the Secretary of State for pointing that out. I misread my script. But if we can vaccinate 29.6 million people, deaths and hospitalisations will be reduced by 99%. That is what we should be targeting now. Of course.
I thank him for giving way. Obviously, the opposition will support tonight. Could he tell the House, further to the exchanges that a number of members on this side had with the Secretary of State, at what point will he and the opposition and the Leader of the Opposition be calling for restrictions to be released on our constituents? And please don't say when it becomes obvious it's going to happen.
Well, the Honourable Gentleman asked a perfectly reasonable question. As we vaccinate more, mortality rates will improve, more, we will be able to save people's lives. But of course, there'll be others who will remain unvaccinated and will be exposed to the virus and will possibly develop long debilitating symptoms of long COVID as a result of that exposure to the virus. So, of course, I do believe that we can begin to ease restrictions once we increase the proportions of those who are vaccinated. But we will not be able to go back to normal yet because the virus will still be circulating. And even though people may not end up in hospital and on ventilation, there are many people who have contracted this virus who remain incredibly ill as a result of the virus. Yes.
Please, the generally positive way in which he has approached this, which does him great credit. Can I perhaps help him out and make a suggestion? And that is every year we accept a certain amount of deaths, tragic, sad deaths from seasonal flu, up to 28,000 in recent years. Would it be reasonable to anticipate the number of deaths that are going to be caused by this virus and try to make a political judgment, for political judgment is what it is, on what we feel is acceptable, and that will give us our criteria for deciding when to lift this lockdown.
I mean, the Honourable Gentleman, again, makes a reasonable point, like the former Public Health Minister. But this is not just a simple calculation about the number of deaths that are saved. Now, he's got much more clinical experience, more clinical experience than I have, obviously. But there are people who suffer long-term debilitating conditions as a result of this virus. There are reports of people developing psychosis as a result of this virus. There are reports of people developing long-term breathing problems, problems with the rhythm of their heart as a result of this virus. It remains an extremely dangerous virus, regardless of whether you end up in hospital or not and on ventilation. But the Honourable Gentleman is quite right. In the end, this will be a judgment for politicians and a judgment for this House. It's not a judgment for the Chief Medical Officer and the Chief Scientific Advisor, although I would hope that our judgments in the end are guided by the Chief Medical Officer and the Chief Scientific Advisor. Let me make a little progress. I will, and then that will be my last one. If that's
grateful, and I too commend him for the constructive approach he's adopting, and he clearly has a very good relationship with my right honourable friend. Can I just ask him to assent to this proposition, which is actually public confidence in this vaccination programme is critical if we want people to comply with these lockdown measures, and that we must do nothing that creates false expectations or unrealistic expectations about how this vaccination programme will go. We must be modest in what we promise, and hopefully we will overachieve. Can he assist my right honourable friend in that objective?
Well, of course, I always think as a rule in politics, it's always better to under-promise and over-deliver. And maybe the whip on the Treasury bench could send that advice to the Prime Minister, because he tends to have the opposite approach to some of these matters, I would say. Now, look, we should be targeting more, our big target should be to vaccinate more, particularly NHS staff, because many NHS staff on the front line, in the face of danger, are scared, they are exhausted. And many feel, as they have said to me, that they were sent out in the initial weeks of the first wave without the protection of PPE, and now they're exposed again without the protection of inoculation. So will the ministers move heaven and earth to get all frontline NHS staff vaccinated urgently? And can we have a clear date by which those NHS staff on the front line will receive the vaccine? And if manufacturers can increase supply, what more can be done to improve distribution? In addition to GPs, I know our community pharmacists have tremendous links with hard-to-reach communities. We need to be making full use of them. Vaccination, Madam Deputy Speaker, not only saves lives, not only is it the route out of restrictions, it is also urgent, because we are now in a race against time. The B117 strain is fast becoming dominant and has done in just a matter of weeks. The more virus there is circulating, the more there are opportunities for further mutations. Mutations that could give this virus greater advantage. Possibly a variant where vaccines no longer work, risking another devastating COVID wave in winter 2021. Vaccination, both at home and across the globe, is now fiercely urgent, and the race to vaccinate is therefore literally a race against evolution. We are also supporting this lockdown tonight, Madam Deputy Speaker, because we know we have to reduce transmission. That is why we're asking people to stay at home. But not everyone can work from home on their laptops. There are 10 million key workers in the United Kingdom, of which only 14% can work from home. Key workers, many low paid, often using public transport to travel to work, in jobs that, by necessity, involve greater social mixing and more exposed to risk. And often, because of their home circumstances, they end up exposing others to risk as well. We witnessed this in Leicester, where it's suspected a spike back in the summer was the result of a spillover of infections into the community from those sweatshops who didn't adhere to proper health and safety rules. We need to make sure our workplaces are COVID secure, otherwise we won't get on top of transmission. So what support is the government offering to install ventilation systems into workplaces? Will the government introduce a safety threshold for ventilation of indoor workplaces without outside air? And given the B11 strain is so much more transmissible, is the government considering reintroducing the 2-metre rule? And when fewer than 20% of those who should isolate do so fully, will the government finally accept that sick workers need proper sick pay and support? Otherwise, they will be forced to work spreading this illness. Madam Deputy Speaker, the British public have done so much over the last year and made great sacrifices. We are a great country, and our people can and will rise to the occasion. All everyone asks is for the government to do the right thing at the right time. Make all workplaces COVID secure. Vaccinate health workers as soon as possible. Introduce decent sick pay and support to isolate. Roll out a mass vaccination plan like we've never seen before. This is a race against time, a race against evolution, and we will support this lockdown tonight.
I will now introduce the 3-minute time limit, and I remind Honourable and Right Honourable members that when a speaking limit is in effect for backbenchers, a countdown clock will be visible on the screens of Honourable and Right Honourable members participating virtually and the screens in the chamber. For Honourable and Right Honourable members participating physically in the chamber, the usual clock in the chamber will operate. We now go to Robert Halfon.
I want to begin by thanking the Health Secretary, his ministers and advisors for all they're doing, working day and night to try and keep the country safe. Whilst I understand the government's health measures, I really worry about school closures. And we need to know if a risk assessment has been done as to the loss of learning, impact on mental health, and safeguarding hazards to children not in school. Not so long ago, 1,500 members of the Royal College of Paediatrics wrote that school closures significantly affect children's well-being. We now know there has been a huge fourfold increase in eating disorders amongst young people, in part due to school closures and social isolation. Children's groups and charities have warned of a new frontier of vulnerabilities, children out of school exposed to online harms, exposed to county line gangs, exposed to tough situations at home like domestic abuse. And we know that school closures put enormous pressure on parents' livelihoods and well-being as they have to juggle their work whilst looking after their children or reduce their hours. So I'd urge the government to consider the following. First, to ensure that teachers and support staff are given priority for vaccinations alongside NHS workers, solely for the purpose of getting schools open sooner rather than later. Second, for more resources to be put into mental health, having practitioners in all schools to help with the fallout from closures and isolation so that pupils, parents, teachers and support staff can access mental health support whenever they need it. And third, the Department for Education Ofsted should partner with schools as candid friends to ensure quality remote education for all pupils. The Chief Inspector of the Schools, Amanda Spielman, has said that 1 day of national school closures equals around 40,000 child years in total. That is a grim statistic. As a country, a choice must be made. Do we value the coming generation of our young children or not? Are we going to risk their life chances to climb the educational ladder of opportunity by shutting down real schooling from their lives? We need a guarantee that the plans for school to reopen after the February half term is signed in blood and not just a guideline. While we absolutely have to be careful of this awful virus, we cannot risk an epidemic of educational poverty and mental health affecting our younger generations for years to come.
We now go to the SNP spokesperson, Dr. Philippa Whitford.
Thank you very much, Madam Deputy Speaker. A year ago, when the SARS-CoV-2 virus emerged, there was no handbook on COVID. All governments had to feel their way, but there's little excuse for repeatedly making the same mistakes a year on. Go early and go hard has been the consistent advice of public health experts. Michael Ryan of the World Health Organization said at the start of the pandemic, the virus will always get you if you don't move quickly. Yet just last week, the Health Secretary still refused to put England into Tier 4, despite surging case numbers and the devolved nations already being under tight restrictions since Christmas. After the late lockdown in March and rushed reopening in May, the government allowed rates of infection in England to run 7 times higher than Scotland or Northern Ireland over the summer. And at that time, chose not to agree a zero-tolerance COVID policy so as to eliminate community spread of the virus on a UK-wide basis. The gains of lockdown were gradually lost as Eat Out to Help Out drove up cases in August and September, thus beginning the second wave. The UK is one of the few countries that never closed its borders, and many new strains of COVID were imported by people travelling to Europe on summer holidays. Even now, in the middle of the second wave, the UK does not have strict testing and residential or monitored quarantine for arrivals. On the contrary, the government has sought to grant further exemptions to quarantine rules. In September, the Prime Minister ignored the tenfold rise in COVID cases and his own advisory group to listen yet again to the proponents of disease-driven rather than vaccine-based herd immunity, leading to a 6-week delay in instigating the autumn lockdown. Herd immunity can only be safely achieved through the use of a vaccine, and even then, only if the vaccine prevents transmission of the virus and thus also protects the unvaccinated. That is the hope, but we do not yet know if either of the vaccines used in the UK will achieve this. It is understandable governments are wary about the use of tight COVID restrictions and their impact on our economy and society, but it is a false dichotomy to set public health against the economy, lives against livelihoods. People simply choose not to endanger themselves or their families and need to have confidence that the risk of catching the virus is very low. Allowing increased levels of spread and therefore high rates of viral replication also contributes to more frequent mutations and increases the risk of generating yet more problematic new variants. With cases growing exponentially, it simply isn't possible to vaccinate our way out of this current surge, so I welcome the decision for this lockdown. But it is tough on everyone, and both individuals and businesses will need support to get through it. That's why it's bitterly disappointing to hear that the £375 million of support for businesses in Scotland, promised just yesterday by the Chancellor, has now been rescinded, leaving Scotland with no new funding to deal with the economic impact of this current shutdown. The government must also consider what strategy they will follow at the end of the lockdown. It should be maintained long enough to achieve suppression of community transmission and establish a more systematic approach to test, trace, and isolate. It's critical to provide both financial and practical support to those who need to isolate, as it is only isolation which actually breaks the chains of infection. Strict controls at external borders would avoid importing more COVID cases and new variants. Such a COVID-secure approach would allow the domestic UK economy to fully reopen, with the government then able to target financial support at the industries associated with international travel, such as aviation and aerospace, which have been so badly impacted by the pandemic. If we look at countries like New Zealand, Singapore, and Korea, who have tight travel restrictions and quarantines, they have eliminated community transmission and been able to fully open up their economies and societies, including schools, hospitality, and domestic tourism. We only have to look at their Christmas and New Year celebrations to see what could be on offer to us here if we get things right.
Sir Graham Brady.
Thank you, Madam Deputy Speaker. May I preface my remarks by saying that I accept that we are in a serious situation, worse in some areas than in others, but that hospital admissions are rising across the country, albeit that improved treatments are meaning that fewer people are progressing as a percentage from admission through to ICU, and fewer people as a proportion are dying as a result of it. And therefore, some of the pressure, I understand, is on general beds more than ICU. Restrictions in this context may be necessary, and we should certainly all take personal responsibility. And I share my Right Honourable Friend's enthusiasm for an effective and rapid vaccination programme. But this doesn't absolve this House of its responsibility to protect the liberties of the British people or to hold government to account. Neither of those things would be consistent with approving regulations that would allow a full lockdown to be in place for the next 3 months to the 31st of March. Today, both the Prime Minister and the Secretary of State have given me reassuring words that they don't want that, but the regulation gives the power to the government to decide that, not to this House. And I urge my Right Honourable Friend again
to reconsider and to look at whether he might be able to promise to bring a further vote at the end of January and at the end of February, so that this House will decide whether these extreme controls remain in place for that long or not the government. I share my right honourable friend from Harlow's concerns about getting schools back as soon as can realistically be done. My right honourable friend knows that I have considerable concerns about the fundamental human rights which are being taken away under these measures. The right to see your children or grandchildren, these really are the most basic rights, and now to be taken away for up to a year for some people. These points are critically important, but I won't repeat them. What I would want to say finally to my right honourable friend is that people will tolerate restrictions where they can see a genuine rationale, when they can see there's some common sense behind them. And I return to some of the questions that I was asking back in the spring, in the first lockdown. Why does it make sense that I can buy flowers in a supermarket, but an open-air market can't sell them? Why is it illegal to go out for a walk on your own twice in the same day? And why, when it is legal for two members of the same household to take a walk across a golf course, is it illegal for them to play golf while they're doing it?
We now go to Vicky Foxcroft.
Thank you, Madam Deputy Speaker. Today, I would like to focus on one particular group who have felt forgotten throughout this pandemic: disabled people. In reading the updated regulations, I can see that no assessment of the impact of lockdown on disabled people has taken place. This must change. Disabled people must be central to our decision making, not an afterthought. Communication has been poor. Shielding letters have been arriving far too late, leaving many unsure of what guidance they should be following. At Monday's press conference, shielding was reintroduced, yet the government website doesn't have any updated guidance for shielders. The guidance that is there is not in an accessible format. People urgently need this evidence to ensure they can continue to be paid. The government's press conferences, which are communicating extremely important public information, are still taking place without a British Sign Language interpreter. It's unbelievable that this has not been sorted. At the start of this crisis, disabled people raised with me their concerns around accessing food, medicines, PPE and social care. Many have faced increased costs, yet we still haven't seen any uplift to legacy benefits. Ministers originally said this would take up to 8 weeks to sort. 10 months later and no progress made. Will this increase ever materialise? The Women's Inequality Select Committee report, Unequal Impact, Coronavirus, Disability and Access to Services, calls for an independent inquiry into the causes of adverse outcomes for disabled people. ONS statistics show that 2/3 of those who have died from coronavirus in England and Wales have been disabled. We also need the Scottish Government to collate this data to enable us to fully understand the impact of the pandemic on disabled people. And sadly, the funding for disabled people's organisations has been cut. Being guided by disabled people's experience is essential. I want to thank everyone who's contacted me about today's debate. I'm only sorry time restraints can't mean that I can't raise everyone's points. I'll end by asking one simple question. As the government's disability unit looks to recruit 14 disability and access ambassadors, how many of these will be experts by experience? How many will be disabled people? I hope the answer is all of them, but I fear not. The government must ensure that disabled people's voices are at the heart of decision making, and this is more crucial than ever during a pandemic.
We now go to Dame Cheryl Gillen.
I'm pleased there is more that finds common cause across the political divide in this time of national emergency than divides us. These regulations are retrospective and not amendable, which sadly reflects the impotence of backbenchers, which should be rectified. and I would like to identify myself with the remarks made by my honourable friend, the member for Altrincham Sale, earlier in this debate. The regulations last until the end of March, but there should be weekly reviews and a debate on the floor of the House at least every 2 weeks during this period when such draconian restrictions have been placed on our citizens. The vaccination effort in this country is remarkable, but we need to do more, particularly as so much fake news is being circulated. Many of my constituents are constantly picking up fake stories about everything from so-called cures and drugs that protect you from COVID to conspiracy theories and priority being given to privileged people. Can we please boost the government communications effort so firm rebuttals and accurate information are issued rapidly and widely to prevent more fear and anxiety? Can we also have frequently asked questions section on the government website to help combat this fake news? Can we add teaching staff to the priority list alongside young adults with learning disabilities and autism, as the PHE data has shown their vulnerability? And the PM missed the opportunity to respond to my question earlier today. Heathrow, throughout the last years, provide a value air bridge for repatriation flights and vital cargo, including medicines and PPE. It has only been given a proposed 7% reduction in its £118 million rates bills, whilst airports in Scotland and Northern Ireland and even supermarkets have a 100% waiver. We're lagging behind other international countries, so can we have some more support for the aviation sector and review it so its services are not threatened? We also need more assistance to the excluded. We need to examine how we can spread the help to this group who've received nothing for nearly a year. These regulations stop golf and outside activities. This is patently ridiculous, and we need some common sense, for goodness sake, as this sort of nonsense damages our credibility. Most of all, we need an exit scenario set out, and the goals identified publicly, as the most frequent question is, when is this going to end? The PM has set a 15th February date as a milestone, and we need to know, for example, at what stage we hope to have sufficient people vaccinated to say, open our schools safely again, or at what point the levels of incidence and spread of the virus will allow retail and hospitality to reopen. Can I finish by saying locally how fantastic Buckinghamshire Council and Buckinghamshire Health Trust have been throughout this terrible period. People will never know the amazing work they put in to keep our county functioning and our residents safe. Let us not forget what further burdens these regulations are placing upon them and our tireless public sector workers. And if we have to face these restrictions on our liberty, let's at least do the frontline staff the courtesy of observing them.
We now go to Barbara Keeley.
Thank you, Madam Deputy Speaker. With case rates rising and hospitals under pressure, it is clear that these regulations are necessary, and I will be supporting them today. The situation in hospitals is particularly concerning. In London, we are seeing the cancellation of non-COVID care, including urgent cancer treatments. This was one of the most damaging consequences of the first wave, when many people had to wait months for urgent treatment and diagnostic tests. This cannot be allowed to happen again. So can the Secretary of State set out exactly what steps they are taking to guarantee that the most urgent cancer treatment can still go ahead over the next 6 weeks? This lockdown also comes at a time when health and care staff have been working flat out for almost a year. They have gone above and beyond this year, working with inadequate PPE last spring to stepping up over Christmas to ensure that patients continue to receive treatment. This week, a constituent who works in the NHS wrote to me and she said this: I am tired as an NHS employee. I am tired of working beyond my contracted hours because there aren't enough staff in work. I am tired of covering for colleagues who are shielding or pregnant and cannot have direct patient contact. I am tired of not having enough equipment to do my job because it is stuck in the supply chain. I am tired of having to tell bereaved women that their whole families cannot visit due to social distancing. I am very tired. At the start of this crisis, we came together as a nation to thank our health and care staff, but I feel this sense of unity and support for them has been lost. Whether it is doctors being bombarded with abuse from COVID deniers on social media or outside hospitals, or NHS staff not being prioritised for vaccines, we are no longer showing staff the respect and appreciation they deserve for the amazing job they are doing in this pandemic, and we need to change this. Staff are now being asked to work flat out caring for COVID patients or on delivering vaccines. The government must take a lead on showing appreciation for staff, starting with vaccinations for everyone on the front line. When we debated the Tier 4 regulations a week ago, I said restrictions only work if people can and do follow them. Throughout this crisis, one of the major barriers to self-isolation has been that people cannot afford to do the right thing. The £500 self-isolation payment is only available to those with no other financial resources. So people with savings are being denied this payment. In Salford, 4 out of 5 people who applied for the payment were turned down. We are asking people to spend their savings intended for house deposits or even treatments like IVF to support themselves and their families while they self-isolate. And this is not right. Nobody should be worse off because they're doing the right thing in a pandemic. The government should extend statutory sick pay at the level of lost wages to everyone asked to self-isolate. Anything less risks people continuing to break self-isolation through financial necessity. Now, these regulations are necessary, but they may not be sufficient. I hope the Secretary of State can ensure that everyone is supported to do the right thing and beat this virus.
Thank you very much indeed, and I certainly will be supporting these regulations tonight with a heavy heart, but nevertheless they are clearly required at this particular juncture. I doubt there's anybody in this country that loathes and detests the restrictions on liberties and livelihoods that these regulations reiterate than the Prime Minister. I am confident that he would not be recommending this to this House unless they were absolutely necessary in his judgment. However, I think it's important that this House has provided more granularity on numbers, and I think this House needs to have a better idea of what constitutes an exit strategy and the trigger points that would allow for that strategy. Jabs offered are not the same as jabs put in arms, and it's that that's crucially important. We need to have published, I would suggest on a daily basis, since ministers must have this information, what's being contracted for, the factory gate delivery against that contract, jabs in arms, jabs that are awaiting deployment because of the 3-week downtime caused by batch and sterility testing. We need to know how many jabs have actually been applied in the past 24 hours by priority group. I will give way to my honourable friend.
Could I add one to that, if I may? Jabs given per area. Because while I know in Hampshire we're in a good place, and I expect to hear so tonight on our briefing call, we can scale up when the supply is there, I know from talking to colleagues across the House that is not the same everywhere. We need to know where the weaknesses are, or rather the vaccine minister does, so that he can then address that.
That's a fair point made by my honourable friend. Data that has to be available clearly because it's gathered locally. That would be very useful, particularly for constituency members of Parliament. The thing that worries me most, Madam Deputy Speaker, is the exit strategy. The Secretary of State perfectly reasonably said we do have a sort of an exit strategy in that we now have a vaccine, which we clearly didn't have at the beginning of last year. But we need to decide, and this is a political decision ultimately, what constitutes the criteria for coming out of this lockdown. Now, it's been generally said that it happens, it's been suggested that it happens when we have vaccinated everybody in group 4 in the JCVI's list of priorities, and that's perfectly reasonable. That is to say, when everybody over the age of 70 has been jabbed, as opposed to everybody over the age of 70 having been offered a jab. The two, as I've said, are quite different. But I think we need to challenge that. And we need to push back on that, because notwithstanding the remarks made by the honourable gentleman who speaks for the opposition, the honourable member for Leicester South, long COVID, awful though it is for those who are afflicted by it, does not constitute a reason for continued lockdown and the penalty that this country is paying societally, medically, economically for what we are about to vote on this evening. That does not stack up. What stacks up is the awful, grisly calculus of lives saved. And we have a benchmark, Madam Deputy Speaker, and that is the number of lives that tragically we are compelled to accept every year through seasonal flu deaths. That gives a reasonable benchmark of what politically and societally we might be capable of accepting. And because we can project how many deaths will happen, and ministers are very keen to do that in recommending to this House correctly that we vote for these this evening, they must have an idea, given the number of people that have been vaccinated in key groups, how many deaths there will be in the ensuing month or 2 months or whatever you like to choose. And I would just push back very finally on one issue, and that is the people who are in group 4. And I think it is reasonable perhaps for those who can be expected to remain safe through who is shielding, perhaps to be considered as part of Group 5, because that will enable people over the age of 65 to be vaccinated, many of them, and that will enable us potentially to be able to come out of this awful lockdown just a little bit sooner and meet the challenging targets that have been set by the Prime Minister.
What a great speech.
We now go to Clive Lewis. Trevelyan. Mr. Lewis has apparently withdrawn. Anne-Marie Trevelyan.
Madam Deputy Speaker, thanks to the superhuman efforts of our NHS teams and to the forward thinking of the Prime Minister back in March 2020 to throw all our UK resources to supporting industry and the global virology scientific networks in search of vaccines to becalm the threat of COVID-19, there is light at the end of this lockdown tunnel. I think that total commitment across government has proven worthwhile, and I'd like to pass on my thanks from all those across North Northumberland, an enormous thanks to the 24/7 dedication both to finding a vaccine alongside delivering that vaccine, rolling off those production lines now into glass vials in their millions, into trucks and to our hospitals and GP surgeries, and in the weeks ahead I hope to sports centres and pharmacies too. My constituents, whilst frustrated at having to remain isolated from family and friends once again, are in a better place about supporting the PM's difficult decision this week because their vulnerable family members are indeed being vaccinated. But we are very anxious about the challenges of homeschooling once again for all but those SEND and key workers' children. There will be many a difficult moment in all those households as students struggle to make the progress they would be able to do in the classroom. So we must ensure, please, that the restricted schooling part of the lockdown is as short as possible, and that all pupils from primary to tertiary are back in their classrooms as soon as the R8 decline becomes clear. Because we know that schools are safe places thanks to the efforts of all our head teachers and their teams over many, many months. So that damage to our next generation must be as limited as possible. I am particularly concerned that the cancellation of GCSE and A-levels in their usual form will leave many long-term gaps in that learning created by the loss of a definite deadline to work to. As a mother of two whose both children worked only to an immovable deadline, this would have been a disaster in my own household. I can only be grateful they are now both grown up. But I do know that compliance to these regulations in Northumberland will be high because we appreciate the risks of our NHS being unable to deliver on the needs of all our patients if our excellent Northumbria NHS was overwhelmed. So, Madam Deputy Speaker, I'd just like to end on an optimistic note, which is that last week I had the privilege of dropping into the Well Close surgery in Berwick to see for myself our primary care network roll out of those first doses of Pfizer vaccine. I can only say it was like going into a Christmas party. The sound of bubbling, excitable voices, my wonderful over-80s queuing patiently, being given a timer because they had to sit for 15 minutes to wait to make sure they didn't have a bad reaction, and then the ping as they were allowed to leave and go home again, as if they'd been fully cooked in their baking oven. It was simply the most extraordinary and encouraging afternoon that I've spent in many, many months. So thank you to Hilary Brown, running the service, Dr. Ben Burville in Amble, and the whole team in the Alnwick Cricket Club, making sure that so many of my over-80s are now protected.
Yeah. We now go to Stella Creasy.
Thank you, Madam Deputy Speaker. Government of the people, by the people means little if it can't persuade. Yet surely lacking here is the consistency vital to achieve that. Repeatedly, this government has simply offered chaos in its place. No wonder the public are fed up. Millions still haven't had any financial support. Hundreds of thousands have lost their jobs in hospitality or retail with little alternative in sight. Clarity Products in my borough employs residents who are disabled. Despite money being claimed from the taxman for them to be furloughed by their boss, Nicholas Marks, many still haven't been paid. People who can't get a job, a new one because they were furloughed before the regulations were less restrictive. The people who won't go and test because they can't afford to self-isolate. In my own community, 75% of the claims for payments for isolation are being refused. The parents of children over the age of 1 but under 5 who can't form a support bubble, as if a 14-month-old is no trouble at all compared to an 11-month-old. The nursery staff terrified because nobody can actually explain why primaries are being closed to reduce the numbers of community interactions, but they are not. This legislation removes the school run as a legitimate reason to leave the house. Ministers tell us this is to reduce virus transmission, but they can't explain this to a family that has 1 child in preschool and 1 child in primary. Or the kids in special schools whose needs just seem to be a simple afterthought at best. those who still don't have access to the internet, and the teachers now having to tell them they still don't have the laptops. I pay tribute to the head teachers in Walthamstow who told us today that their first task has been to buy sandwiches for the kids who are hungry and vulnerable, but whose families don't qualify for free school meals. All those people in care homes, ignored in this regulation, so it's not clear whether visits are still possible. Or the shielded, told again to lock down, but nobody can explain why they are not a priority within the priority groups for vaccination. Or the homeless, now being left out again on our streets this winter. Indeed, the only time this government has been consistent is to avoid scrutiny, whether shutting this place down or ignoring questions. Ministers have finally admitted today that they won't tell us what performance standards they're holding Serco to for the test and trace scheme, but apparently they do know that they haven't broken them. What a kick in the teeth to all those people in the NHS working flat out to save lives, see these private companies make millions from the NHS, but fail to deliver, whilst they struggle for oxygen supplies, turn ambulances away, and don't know when they will get the vaccine themselves. We will vote for these regulations. We want them to work. But if we want to persuade the public to support them, ministers owe it to them to own up to what has gone wrong. To say, sorry, it's so confusing. Sorry, it's so chaotic. Sorry, you can't hug your grandparents right now. Every family making sacrifices deserves that apology and a government to do better.
Now go to Damien Hines.
Thank you, Madam Deputy Speaker. And it would be an understatement to say that people have restriction fatigue. And I, like others, hate having to have the sorts of curtailments on people's freedoms that a lockdown means. And it's right, indeed, it's essential that these regulations be time limited. And I welcome the stipulations on regular reviews. But I will be supporting because the contrast, the choice before us is not between having curtailments or not. It's about the very difficult things that as a country, as a society, we do now, as against even harder things that we have to do in the future. And the data, Madam Deputy Speaker, are startling. In Hampshire as elsewhere, looking at the dramatic growth in the case rate since the start of December. And without truly stringent measures, there is a real risk of overwhelming the NHS. And that word, overwhelming or overtopping, these have become commonplace phrases, but we do need to stop, pause and reflect on their true meaning and implications far beyond COVID. The difference, of course, now, as the Secretary of State said, is vaccination. We can see ultimately a way through. And it's been impressive to see the speed with which the Hampshire vaccination programme has got off the ground. Clearly now, all hands have to be to the programme. I was pleased to hear what the Secretary of State said about the removal of red tape barriers to volunteering. And clearly there needs to be close attention to every stage of production, distribution and administering the vaccine. As well as the business support during lockdown, we're also clearly going to need a sector-by-sector plan for how we come out of this for sectors like pubs, like hotels, like so-called non-essential retail, very essential to our high streets and to the events business. And we're going to need a national effort and mission on the return to school, preparing ahead of that for when it comes, repairing the impact that this period will have had again on children's lives and trying to get them back on track. It'll need different approaches for different age groups, different individual children. Some will have fallen back in some subjects, but not others. Some, of course, will have had truly terrible experiences in this time, and that will also put a strain on children's services departments, which we need to recognise. More generally, we're going to need even more attention than ever before around children and young people's mental health, and actually also getting back to physical exercise in some cases. There will need to be specific interventions in schools. The tragedy, of course, is that some of those had already started, and there is this £1 billion fund in place. That needs obviously to be kept under review. I very much welcome what the Prime Minister said earlier about one-to-one tuition. But we also need to think about what needs to be done to overcome the constraints on that. It's already hard in some places finding supply teachers, let alone one-to-one tutors. And there'll be a more important role than ever before for volunteer readers, for mentoring programmes and strengthening links with business. I hope my right honourable friend can assure me this is being considered now across government.
We now go to Richard Bergen.
Madam Deputy Speaker, just over a month ago, this House voted on the tier system. I voted against. It was clearly inadequate to get the virus under control. I warned a lockdown would be needed in the new year if the government took its foot off the brake, but the government ploughed on, recklessly ignoring its own scientists, adding to our shameful death toll. I also voted against a tier system because of the lack of economic support. This lockdown is now necessary because government failures let the virus run out of control. But lockdown alone won't be enough to drive the virus down and to keep it down. A wider public health package must be in place alongside the vaccine. That must be driven by the principles of a zero COVID suppression strategy that has seen the virus virtually eliminated in many East Asian and Pacific countries, and which, if followed here, would have saved thousands of lives and allowed us to reopen the economy. The lockdown must also go hand in hand with an emergency financial package for our communities. This out-of-touch government can tell people to stay at home, but too many simply can't afford to do so. Poverty and destitution should not be the price our communities pay for government failures to tackle the virus. Just as the banks were once bailed out, we need a people's bailout for our communities if we are to defeat this virus. That means all non-essential workers who can't work from home being furloughed on full pay. All parents who can't work because they're dealing with childcare should be guaranteed furlough on full pay. Sick pay should be introduced at real living wage levels so people can afford to isolate. It means a minimum income guarantee, including for all self-employed people. And it means rent relief as well as an evictions ban so no one loses their home. Every child should be guaranteed a laptop and internet access to learn at home. And with universities moved online, tuition fees should be scrapped and accommodation costs reimbursed. Madam Deputy Speaker, this government's actions, inactions, delays and negligence have unnecessarily condemned tens of thousands of people in our communities to early graves. I hope justice is one day done. And its lack of financial support for people is causing wider social harm. It's shameful that hasn't been addressed today.
We now go to Ian Liddell-Granger.
Madam Deputy Speaker, thank you very much indeed, and I'm very grateful to be able to take part in this debate. There is no doubt this lockdown was needed and required, and quite rightly has now been enacted. But I would say I cover the vast rural area of the Exmoor and obviously the Levels in Somerset. One of the things I would ask the government to look at and consider is the rollout of the vaccine. A lot of my area is, as in many, of course, rural constituencies, is a long way from next door. And it is very, very difficult for people to get to vaccine centres. And at the moment, unless we have more places doing vaccines, it is very hard to be able to see what we can do to quicken it up in special areas like mine. There is no doubt that we need to do more. And I will praise, if I may, the 4 district councils in Somerset, and they're not all of my persuasion, who've done a remarkable job in getting the information out across the districts and the county to make sure that we are kept appraised of what is available. And not only that, they have made sure that where hospitals are being used and where they can use healthcare, it is being put forward very, very nicely indeed. I can't say that about the County Council, and people have heard me in this chamber, Madam Deputy Speaker, talk about the Somerset County Council, and quite simply they are to be left wanting at the very highest level, and I'm very ashamed to say they're ours, but they are of the government persuasion, but they are not doing the job. But there is one area that I do want to just concentrate on, and that is, of course, the Hinkley Point C nuclear power station. We must keep it going. This not only is fulfilling our commitment, but because of the way that Hinkley works and because of the continuous pour of cement, Hinkley is crucial. It is a national and international infrastructure project. It is of enormous importance locally and nationally to make sure that we keep those workers safe, but also keep them working. And that is crucial. And that means a lot of the people who live in the area who are of an age where they do tend to have children are finding it very hard to get childcare, but also to make sure that they can actually continue their work. And they are crucially needed on site. So therefore, my conclusion that schools, we need to think about this very carefully. I am very grateful for what the government has done and the way the BBC, for once, has actually stepped up to the mark. But we do need to look at what we do with these children whose parents are working. I have enormous distribution warehouses in my constituency that need people there all the time to keep the system going and keep the supply chain alive and well. And I would urge the government, please make sure the people who need to be vaccinated to keep the economy going are being vaccinated, and keep the vaccines local. And that is crucial. And if we can achieve those, as not only as a government, but as parliamentarians, then I believe, Madam Deputy Speaker, that we've done our job. Thank you.
Now go to Clive Efford.
Thank you, Madam Deputy Speaker. I will support these measures, but I regret the need to implement them. The public are weary of the government's U-turns, dither and delay at crucial moments throughout this pandemic, when what we've needed was decisive leadership. Nothing highlights the government's incompetence more than the approach to education and schools in particular. At the end of the last term, the government threatened legal action to keep schools open in Greenwich, whilst at the same time planning to keep all schools closed in January. And all the time, the government was aware that a new variant was ripping through Kent and the southeast. And today, the government recognised that the new variant was rapidly causing schools to be a vector in our communities. It's been obvious from the start of this pandemic that education was going to be severely disrupted due to school bubbles having to regularly isolate, and that online learning was going to be a regular part of children's education. And the Secretary of State is yet again way behind the curve. He failed to get devices out to children during the first lockdown, and according to Ofqual, 1.8 million children in this country faced the lockdown without access to digital devices. A report in July warned the government of a second spike this winter. It also warned that there was a possibility of a new variant. Yet there has been too little urgency from the government to get devices out to those who need them. Too many children are going to suffer due to the inability of the government to read the facts before them. Now our schools are closed and confidence in the government is shot through. Teachers have seen how the virus has ripped through their schools. Parents are worried for their families. To create the confidence in the safety of schools, staff will need to be vaccinated as soon as possible. Teachers do not need scientists or experts to tell them the risks to which they are exposed when they are in school. Figures published today in the TES show that infection rates among staff in Greenwich schools was almost 3 times the rate of the local community. Teachers see these figures. They need to be confident that they are safe when they return to the classrooms. They have seen firsthand the numbers of colleagues and the pupils forced to isolate and those who have tested positive. The government must not wait to be forced into yet another U-turn. Teachers need to be tested alongside other essential workers, and the government should accept that now.
We now go to Andrea Leadsom. Andrea Leadsom, are you unmuted?
Thank you, Madam Deputy Speaker. I want to make a few short points about the impact of COVID on babies and on young people. But first, can I thank my right honourable friend for his excellent support for the early years review that I'm chairing, which will soon announce its recommendations. My review has heard from many families what a tough time they've had in lockdown. Many struggle at the best of times with a new baby. Add to that being in lockdown with other children who also need attention, and even the simplest of tasks can feel like a massive challenge. So firstly, I sincerely urge my right honourable friend to send an instruction to all our superb perinatal workers, from health visitors to mental health and breastfeeding advisors, to keep providing the support and advice that new parents need, not just for reasons of safeguarding, but also for the many who are really struggling to cope right now. Second, I'd like to heartily commend my honourable friend for Chelmsford and others in government for their determination to keep early years settings open at this time. It's not just to help parents work from home, but crucially it's so that infants and young children do not lose out on their future development through this lockdown. And then finally, I'm really concerned, as so many colleagues are, about any loss of schooling for our young people. So whilst, like many, I applaud the BBC for introducing an element of curriculum-based teaching, I would urge my right honourable friends, the Secretaries of State for Health, for Culture, Media and Sport and for Education to join forces and press the BBC to fulfil its role as our public service broadcaster and take on the job of committing to teaching the whole curriculum. It's great that the BEAB will deliver reading, writing and maths to primary school children, but at secondary school the challenge is different. Students are studying a variety of subjects at different points, so the BBC should build a pick and mix package of lessons for students to choose what they need. And then teachers who've done such a superb job under such difficult circumstances could use those resources as a core to build from. Exercise, nutrition and even support for mental health could form a part of each day's televised curriculum, giving a bit of a boost to young people. Madam Deputy Speaker, our national broadcaster benefits from £157 a year from each licence. This is a chance to provide public service broadcasting at its finest, and it could remove at a stroke the twin challenges of a lack of reliable broadband and a lack of laptop access. Nothing can replace a strong family, good schooling and sound teaching. But our babies and our children and young people deserve the very best that we can provide. Thank you.
We now go to Julie Elliott.
Thank you, Madam Deputy Speaker, for giving me the opportunity to take part in this most important debate on the public health crisis facing this country. I believe it is right to go into lockdown. It is right to stay at home as much as possible to protect ourselves and others, and I will be supporting these measures today. However, these actions should have come much sooner. This is sadly a result of a long line of government failures, from the lockdown coming too late in March last year, through the fiasco of test and trace, to the chopping and changing of tiers and relaxations in the lead up to this latest lockdown. I have many concerns around this lockdown, not least the economic ones, and particularly for those people who are not supported at all by government programmes or by the Chancellor's support packages. But today I want to concentrate on just one, and that is the situation in our schools and the impact on public health. At the 11th hour, schools were instructed to close. In my role as chair of the All-Party Group on Digital Skills, I have raised the issue of the lack of data and devices for school-age children throughout this pandemic for the last 10 months, working with my honourable friend often from Mitcham and Morden. 10 months on and this is still not sorted. Even with the announcement made today by the Secretary of State for Education, around 1 million school-age children will lack the adequate data and devices to effectively learn. This is a disgrace. Children in that position have now been classified as vulnerable, compounding the situation in our schools. Our schools today have being given no guidance on which children are to be in school, which children are not to be in school. Have they got to impose limits? Have they got to include spacing? There is no guidance. I've spoken to many head teachers in my area today. Alternative education hardly gets a mention. They have a frequently changing school population and devices don't follow pupils. The prioritisation, vulnerable children, children with 2 key worker parents, 1 key worker with another parent working full-time, or a key worker with another parent not in work. Social care and hospitals will come to a standstill if this is not sorted. Teachers cannot be in 2 places at once. They cannot teach what is potentially more than half of a school population in lessons and teach online. All of these issues need addressing in order for this lockdown to be effective and our frontline healthcare and social care system to cope, and all of our children and young people to receive an equitable and fair level of education.
We now go to Alberto Costa.
Thank you, Madam Deputy Speaker. None of us wish to pass such restrictions on all our freedoms, We're a parliamentary democracy which cherishes freedom, but here we are about to pass draconian restrictions on our personal liberties. Our job must be to encourage, cajole, and demand from government that it does everything in its powers for the vaccines to be manufactured, distributed, and offered to our fellow citizens as soon as possible. Our ministers are working at breakneck speed, and I would like to pay tribute to the Secretary of State, his fellow ministers, and senior civil servants in central government managing the vaccination programme, and all those other public stakeholders, the NHS, doctors, nurses, organisations, and every individual who is helping to distribute as quickly as possible these vaccines. The more vaccination centres we have, properly staffed and resourced with vaccines, of course, the quicker we can vaccinate our constituents, and thus the quicker we can consider lifting these draconian regulations. Now, turning to South Leicestershire, yesterday I met with the CEO of the local clinical commissioning group, Andy Williams, and his fellow colleagues from the LPT, along with Lutterworth GPs. I thank Andy Williams for having met me at such short notice. I've been reassured by Andy Williams and his team that they are working to ensure that my constituents are offered the opportunity of receiving a vaccine in Lutterworth or Blaby or across South Leicestershire. I know that the House will want to pay tribute to NHS stakeholder groups like Andy Williams and the CCG for all the work that they're doing in opening vaccination centres wherever possible in each of our constituencies across our country. But I did impress on Andy Williams that the decision that we're about to take today as legislators of the sovereign British Parliament in restricting freedoms and in effect closing down large parts of our economy, our education centres, can only be lifted when he and his NHS colleagues succeed in their logistical organisation of opening and operating vaccination centres. So it is right, Madam Deputy Speaker, that we scrutinise the work of the CCGs across our country and all related NHS and other stakeholders involved in this mammoth task. I will be supporting the government today, but only under the clear understanding that government is doing all it can to obtain vaccines and distribute them quickly to all our constituents.
Sammy Wilson.
Thank you, Madam Deputy Speaker. Millions of citizens will be watching helplessly as they see the government plod towards another damaging lockdown while it responds to the Pied Piper advisors in Sage and their mournful dirge of fear and terror, because that's where we're going with these restrictions today. And unlike the poor children in the town of Hamlet, at least we know what the destination is, because we've been there before. We have seen the economic damage which lockdowns do. We have seen the damage which it does to people's mental health. We have seen the damage which it does to education. We know what it's doing to our country's finances. And yet, despite what the government tells us, we are doing this lockdown again to achieve the aims which we were told would be achieved by the first lockdown. We had suppressed the virus. We had put our foot on its neck, was the term the Prime Minister used. And yet, once, twice, and now for the third time, we are doing exactly the same things. And whilst I understand that the government has tried to support industry and support people who have been affected, and that's to be welcomed. And indeed, I know, coming from Northern Ireland, as a unionist, the measures which were taken by the Assembly in Northern Ireland could not have been taken. The support measures could not have been taken had we not been part of the union, and had we not had the resources which the union makes available to devolved administrations. And those who cry after a break-up of the union ought to remember that there is only by being a part of a bigger unit can we ensure that we at least have the support measures. But I would say to the Minister today that we've got this lockdown. I'm fairly sure the date of the 31st of March is there because it's intended to use that period. First of well, yes.
Thank you for giving way now. Does he share the concerns that I have and many others have in relation to the mental health of children? It's been strained like never before. And does he feel that it's time for the school online counselling services at every school for young people to ensure that they have the help that they need as a matter of urgency?
And that's one of the points I was going to come on to. If we are in for this long lockdown, then the government, first of all, cannot continue to abandon those self-employed who have been affected by previous lockdowns and still find themselves penniless and without any support. Secondly, they cannot allow children's education to be disrupted for that length of time. As a former teacher, I know how long periods, even summer holidays, can disrupt children's education. And it's the poorest people who are affected by this, because very often they don't have the resources, the children don't have the space, the parents don't have the ability to help their children through the time off school. And so it's important schools get back. And I know that despite the impression given by some trade unions, most teachers do want to get teaching their children in school. And indeed, some of them have been on to me this weekend saying, look, we want to get back to school, but we do fear, because there's an atmosphere of fear for our own safety. And some priority must be given, I believe, to ensuring that teachers are treated as frontline workers and are vaccinated quickly so that they can continue to have face-to-face education with children. Northern Ireland, of course, depends very much on aviation because of the sea barrier between here and Northern Ireland and the rest of the United Kingdom. And there needs to be a package of support for the aviation industry. There's no strategy there, and there needs to be a package of support made available there. But, Madam Deputy Speaker, the one thing I would say is that these restrictions, if they're going to be in place to the 31st of May, have to be examined regularly by this Parliament, and there needs to be a commitment by the Minister to bring them back on a regular basis so they can be voted on.
Thank you, Madam Deputy Speaker. Can I begin by acknowledging the difficulty of the task faced by health ministers and the Prime Minister in this crisis? We have a proportion of the public that wants to see a full lockdown, irrespective of the consequences to the economy. And we have another proportion of the population that wants to see no lockdown whatsoever, irrespective of the consequences to public health. But even those who reluctantly accept the need for further restrictions must be mindful of the balance between the authority of government and the responsibility of citizens. And I agree with my right honourable friend, the member for Altrincham and Sale, that we need to have sufficient parliamentary oversight during the period for which these restrictions will be in place. And I hope to hear from the Minister a commitment from the government for more debate and regular votes during this period so that Parliament can express on behalf of the public its view. I'd like to say a few words, if I may, about the vaccine programme. Firstly, to congratulate the government on having a world-leading programme on immunisation with two very difficult elements that have to be kept in balance: supply of the vaccine and an adequate number of vaccinators. And of course, these two elements of the logistics have to go hand in hand and at the same speed. Not an easy task for ministers. We will have to have a surge capacity in vaccinators to be able to deal with demographic and regional differences across the country to avoid rate-limiting steps in the process. I made the point to the Prime Minister this morning about how difficult it has been for former GPs like myself to be able to get back into the vaccinating process and the number of courses we've been asked to complete. I was delighted to hear the Secretary of State announce this afternoon that there will be some changes to that. I think it's the fastest action I've ever known from a government. In 28 years, you raise it with the Prime Minister in the morning, you get an answer from the Secretary of State in the afternoon. And I think there is an easy fix, incidentally, to this by getting those who want to come into the programme to fulfil two of the better modules: the COVID knowledge, the core knowledge for COVID vaccinators, and the minimum requirement of staff returning to the NHS. But we will also require more scrutiny of the vaccine process itself if we're to be confident in endorsing the public health policy that we have. We need to look better at the modelling and the data that is out there about the effectiveness of a single dose in creating sufficient population immunity for that to take place rather than the two doses. And we need to look at an assessment of the Pfizer vaccine in producing continued immune response in the time between the 3-week first dose that was originally envisaged and the extended 12-week period. It's essential that we know that this is based on proper scientific data. The key to the success of the strategy will be our ability to understand this data and enable us to unlock the lockdown and get back to normal. This has been a very difficult time for everyone, Madam Deputy Speaker. We must at least learn the lessons for the future, because this pandemic will not be a once-in-a-generation event.
We now go to Margaret Greenwood.
Deputy Speaker, the recent sharp rise in COVID-19 cases across the UK make it imperative that we have a national lockdown. 1 in 50 people in England have the virus. In Wirral, there were 606 cases per 100,000 in the week to the 1st of January, well above the average area in England, which had 481. And sadly, there have been nearly 600 coronavirus-related deaths registered in Wirral since the start of the pandemic. My thoughts are with their families and friends at this very sad time. So we all have to do everything that we can to halt the spread of the virus, to save lives and protect the NHS. As people right across the country play their parts by staying at home, the government must do its job and deliver the vaccine. As part of this, it must make it easier for retired NHS staff to help with the vaccination programme. One retired clinician has written to me to say that he has tried to register as a vaccinator, but found the NHS professionals' website unusable. The government must take immediate action to address this and make it easier for those with valuable medical expertise to volunteer at this time of national crisis. He also asked whether vaccinators will receive priority for the vaccine as frontline NHS staff. This is something that the government must do to protect them and to encourage other people to come forward. With these national restrictions in force, the government must step up and provide real support to the business and workers who will be affected up and down the country. Will the Minister press on the Chancellor the importance of extending statutory sick pay to all workers, including the self-employed, and to raise the level of it? In December, Sir Michael Marmot reported that England entered the pandemic with its public services in a depleted state and its tax and benefits system re-geared to disadvantage of lower income groups. He said the levels of social, environmental and economic inequality in society are damaging health and well-being. So will the Minister take action on the social inequalities driving health inequalities and join me and others across this House in calling on the Chancellor to stop the cut of £20 a week from universal credit? Last month, the Secretary of State for Health stood at the dispatch box and assured me that his government is increasing the public health grant next year. But a junior minister subsequently then told me that local authority spending to the public health grant will be merely maintained. So will the Secretary of State clear up the confusion in his department, commit clearly to increasing the public health grant and set out how much that increase will be? Madam Deputy Speaker, to conclude, we all have a part to play in tackling the virus. The government must ensure that it delivers on the vaccine, provides businesses and workers with the support they need, invests in public health departments and protects the NHS as a public service. Thank you.
Simon Fell.
Thank you, Madam Deputy Speaker. I will try and be brief. There's two areas I want to focus on: getting out of the current position in which we find ourselves and how we live with this virus for a long time to come. I think people generally accept that we are where we are because of the new strain of the virus, and the Prime Minister has had a really difficult choice in front of him: lock down again or risk the capacity of the NHS. But people want to get out of these restrictions as soon as possible. The cost of this virus has ripped on the nation's finances, but also people's livelihoods, their mental health and their children's futures. We've now got a clear path out of lockdown with a vaccine, but we need to see what the roadmap to recovery looks like and start delivering on it. This is the moment for a small boats moment. I very much hope that the government will actively engage and mobilise community pharmacies, growing the base of locations where vaccinations can take place, enabling vaccine delivery 24/7. With every person vaccinated, we get closer to the end of that tunnel that we keep talking about. But freedom's not just about the ability to leave your house, it's about life chances and opportunities. For areas like the North, which has been in effective lockdown for months, we need a clear roadmap for economic recovery too. The pandemic can't lead to further deprivation and more closed opportunities for communities like mine in Barrow and Furness. We need to roll out stimulus packages so we're able to build back from this. And we also need to take people with us. I applaud the government's efforts in transparency over the data they're sharing, but we need to go further, sharing daily vaccination levels by area, being clear about at what point on that journey we start easing restrictions and what the journey back down the tier system looks like. Finally, it would appear that we're going to be living with this virus for some time. Through an incredible endeavour, we've got a vaccine that works against the strains currently in circulation in the UK. There's already disquiet about the South African strain, so we need a clear plan for how we live with this virus and its children. There's an opportunity to strengthen the bioscience and biomanufacturing industries in the UK. The Vaccines Task Force has made huge strides in this area already, but we should be looking to expand the tools in our belt, not just vaccines, but also monoclonal antibodies to help those who've got suppressed immune responses and for whom a vaccine may not be the answer. We can't afford any more delays. Every pound spent on prevention will save many more in the future, save lives and get life back to normal sooner rather than later.
Very good.
We now go to Sarah Owen.
Thank you, Madam Deputy Speaker. Even before Christmas, anxiety was building and building as scientists warned what was ahead. The public could see what was coming. It seemed the only person who did not want to face up to the scale of the current COVID-19 situation was the Prime Minister. On one of the MP briefings of the Secretary of State, the Public Health England lead clearly stated that the change point for London came at the end of November. Yet no action was taken by ministers until it was far too late. Again. At every point of this crisis, the government has been reactive, not proactive, waiting until we are at crisis point to do anything. Over 76,000 people dead, families pushed to the edge, hard-working healthcare workers and hospitals at breaking point. This isn't the situation in other countries, yet it is here, and that is not all down to the new variant. The failure of this government to plan more than a few days ahead means people, organisations and businesses are given days, sometimes hours' notice of changes to rules. People can't and shouldn't have to live like that. This anxiety is perhaps most acutely seen with young people. Today I spoke with the head of our fantastic Luton Sixth Form. There are 752 BTEC students, many taking exams this month. Again, they are left out of guidance, left waiting for confirmation of their futures. It is time this government stopped treating BTEC students as an afterthought and give them the certainty they deserve. And if we are to be ready to get back into classrooms in Luton North and across the country at the end of February, like we all want to see, we must see nursery staff, teachers, school support staff and school cleaners included as part of a vaccination strategy. And when it comes to a vaccination strategy, will one be published anytime soon? Because ramping up isn't a coherent strategy. We should know by now how long it will take to manufacture the necessary vaccines. What measures will be put in place to make sure that they are disseminated and delivered? Why not publish a schedule of delivery? Will people who can't be vaccinated be protected with ongoing shielding measures? What is the estimated critical mass needed to be vaccinated before we can start to relax restrictions? What measures will need to be introduced or continue while vaccinations are rolled out, or if they fail to combat any new variants? These are just the very basics of any vaccination programme. Yet we have heard very few answers from this government. To provide hope and a route out of the restrictions before us, we need to see an exit strategy. The public need to be informed every step of the way, not only when it is too late.
Mark Harper.
Thank you very much, Madam Deputy Speaker. First of all, can I thank you and the House staff for ensuring that we were able to be recalled today for the second time in a week to debate these important matters. That's important that this House is at the centre of this debate. I want to say, first of all, I recognise that the new variant and the significant growth in cases and the resulting pressure on the NHS does mean we're in a different position than that we faced in November. And for that reason, I won't be opposing these regulations, as I did when the government brought them forward in November. But I do agree with what my friend, the Honourable Member for Altrincham Sale, said. I do think that regulations that run all the way to the end of March is too far a distance in the future. And it seems to me the obvious checkpoint for government to come back to this House to seek the authority to proceed is the middle of February, when the Prime Minister set a very clear goal to have vaccinated those 4 first groups that the JCVI have set out, and when the government's going to have to make a decision about whether schools return after the February half term. It seems to me that would be the point, that the government should bring that information to the House, set out its proposals, hopefully at that point to relax restrictions and to get children back to school, and to seek the House's authority to do so. And I would suggest that if ministers could go away and reflect on that and come back to us next week when the House returns after this recess, I think that would be welcomed by colleagues. Of course.
Just to the point of the schools, I just wonder what my right honourable friend's view would be about the vaccination of teachers, because if keeping schools open is such a priority for the government as it should be, then surely, however difficult it is to move that group up the vaccination list, it has to be something that we would consider, and to do that, to open them after half term, it has to be something that we do pretty much pronto.
I understand the point that my honourable friend's making, and it's been made by others. I have to say for myself, and obviously I'm not a clinical expert, I think the JCVI have got it right. I think the priority, no matter how important schools are, it has to be focused on reducing the number of people who are going to die and the pressure on the health service. And I think those are the right choices to make, because many teachers, those that are much younger, those that don't have underlying health conditions, the risk for those staff members is very low. And if they're in the high-risk groups with, for example, a serious underlying health condition, then they will already be going to be vaccinated early according to what's been set out. And I think that's the right approach. As soon as you move away from that, every group of frontline workers potentially exposed to the virus will make an argument that they should be higher up the list. And I think that would not be a sensible way of the government proceeding. So I think it should stick to the process set out by the JCVI. Two final points, Madam Deputy Speaker. On the vaccination schedule, I do think maximum transparency, as the Prime Minister said, is welcome, and I would urge the government in its daily vaccination numbers, and by daily I assume we mean 7 days a week, not just 5, we need to publish as much information as possible by region, by cohort, so that we can see how this is going and which regions of the country are going well, and potentially to have some positive competition where people are trying to do better. And my own region in Gloucestershire is making good progress, and I'd be pleased to see that information in the public domain. And I think the agreed delivery schedule from suppliers ought to be published. I think that'll give people confidence, and then I think we can all focus, as perhaps putting it in terms the Prime Minister would use, focus on getting vaccination done, which should be the nation's #1 goal in the next few weeks. The final point I'd make, because I know it's been talked about outside this House, vaccinating those priority groups doesn't just reduce the risk of death by a huge amount, by I think about 80%. It also reduces by almost 60% the hospitalisations, which of course therefore reduces the pressure on the National Health Service. Both of those factors mean that once we've vaccinated those the first 4 groups, I think we can be bold about looking forward to relaxing restrictions, and I hope the government can come forward at the earliest possible opportunity.
We now go to Mike Hill.
Thank you, Madam Deputy Speaker. I'd just like to say I'm immensely proud of the people of Hartlepool for the way they've faced up to this crisis and the spirit of determination that they've shown in overcoming the barriers of this pandemic. And I would like to especially thank all of the volunteers here in Hartlepool for the work they've done. They've done so much. They've kept our communities together. And I'd just like to take the opportunity to record my gratitude for the work that they've done. But in terms of the lockdown itself, there's many unresolved issues, particularly on the issue of work. There's distinct lack of clarity in regards to rules about who should or should not be working, who should be staying at home. And the recent example we've seen of schools. Why did the Education Secretary and the Health Secretary persist on Monday with their line that schools should go back in, only for the Prime Minister on the Tuesday to say that schools should be shut? The health and safety implications, the work implications are enormous, and and the lack of clarity is not helping my constituents over matters like that. I'd like to say also that in terms of health provision, I'd like to see more commitment from the government to input into health commitments in my constituency, particularly around mental health, and to ramp up the vaccine provision. It's essential, it's important for the well-being of my constituents. But like everybody else in the country, the people of Hartlepool just want to see the light at the end of that tunnel that's always been mentioned, and want to see the rollout of the vaccine ratcheted up so that the nightmare can end for them and order can be re-established sooner rather than later. They understand the need for this lockdown, Madam Deputy Speaker, and the majority support it. But what they also want to see, what they want to see is clear leadership and direction from the government. No more dithering and no more delaying. And given the current R rates in Hartlepool, it would be irresponsible not to support the current position adopted by this government or to disobey the rules. But I say to the Minister, please, please don't test our patience. The people of Hartlepool have survived 2 lockdowns. They will survive a 3rd lockdown. They've got the stamina and the community spirit to do it. But Minister, please don't let them down. Get those vaccines out there and get our people and businesses supported here in Hartlepool and the North East. Thank you.
We now go to Simon Clark.
Thank you, Madam Deputy Speaker. I'm in total agreement with the government that the emergence of the new, more transmissible strain of the virus has once again changed the logic of where we stand and how we should now act. This week, we have effectively ended the difficult balancing act of trying to split the difference between containing the virus and keeping as much of our economy and society open as we can. A combination of our now having 2 safe and effective vaccines and the emergence of the new variant of COVID means that our focus is now overwhelmingly on containment. And I think that is the right choice, indeed probably the only choice that any government could take at this moment in time. For ministers to acknowledge this is not to show weakness, nor was it wrong to try to do everything in our power to try to retain some semblance of normality, and most especially in our schools. For let us not for a moment pretend that there are not very serious trade-offs in re-entering lockdown. The pain felt by the lonely, struggling business owners, children unable to attend class, and parents trying to raise them at home while working is all real and deep and miserable. Nonetheless, the data is impossible to argue with. 1 in 50 people in our country is ill with this virus, and the numbers are rising. So I welcome the Prime Minister's announcement warmly that we'll vaccinate all those in tiers 1 to 4 of the JVCI strategy by the middle of next month. It's great news that 1.3 million people have now been vaccinated, more than in the rest of Europe combined. But we have no time to waste in accelerating this. Every week that we're in this situation costs thousands of lives and billions of pounds. I have the highest regard for the Vaccines Minister, and I wish him every success in mobilising every deployable resource to combat this monster. Any business that can fight weak links in the supply chain should be enlisted to help. Any building that can sensibly be turned into a vaccination hub should be requisitioned. And when it comes to administering the vaccine, this should include the full use of the armed forces, dentists, community pharmacists, vets, and retired medical professionals. We must not be encumbered by needless bureaucracy, and we must not be constrained by normal working hours. I welcome the new daily vaccine statistics we'll receive from Monday. To help monitor progress, it would also be helpful to know our projected weekly trajectory for getting priority groups vaccinated. Madam Deputy Speaker, I also want to focus very quickly on one other issue, which is maintaining the highest quality education offer this winter. Our schools must not hesitate in accepting the children of key workers, and if a school has an unusually high proportion of key worker children, options should be looked at with neighbouring schools to provide support. We also need to focus on ensuring rigorous attendance by children in remote learning and ensure that no child misses out because of lack of internet or appropriate devices in their home. And I warmly welcome the announcement from the Education Secretary today to that point. This is a national crisis, Madam Deputy Speaker. I'm absolutely confident we'll overcome it together.
We now go to Munira Wilson.
Thank you, Madam Deputy Speaker. So here we are again, another month, another late lockdown, and all the harm that lockdown brings with it. Lost learning, lost livelihoods, and loneliness. Yet this drastic and painful action has tragically become once again, our only option, given the alarming rate at which the virus is tearing through our country and the immense pressure on the NHS. A clear exit strategy from lockdown is critical, to which vaccines are central. So my Liberal Democrat colleagues and I reiterate once again our request to ministers to publish a clear plan as to how they will meet their initial target of vaccinating the most vulnerable, but also all adults beyond that. This plan needs to involve not just the NHS, but the military, the private sector, the voluntary sector, local government, and community pharmacies, whether they're big chains or independents. We need a 24/7 vaccination programme brought to every high street in the country so that those who are in hard to reach groups or those who find the hubs hard to reach can access these life-saving jabs. If the Prime Minister's serious when he says every needle in every arm makes a difference, why is it a physiotherapist in my constituency who's completed all the paperwork and training is yet to be called upon? We cannot afford to lose a single day. But alongside vaccination, we have to continue finding, testing, tracing, isolating every case, and importantly, supporting every individual with the virus and their contacts. Although we will be better protected from serious illness through vaccination, we must stop transmission, not least given the emergence of ever more variants. This is why it's utterly astonishing that none of the announcements in recent days have even mentioned test, trace, isolate. Have ministers given up on this vital and basic public health tool? People need to be paid to stay at home for 10 days if they've been told to self-isolate. That's full pay, not sick pay, not £500 after lots of red tape. And it's far cheaper than endless lockdowns. It must come with practical support too. Finally, compliance and trust is built through transparent communication. What are we all working towards? In particular, what do the numbers need to look like before ministers will reopen schools? We can't underestimate the impact on children's learning, their well-being, and the pressures and stresses that parents who feel like they've been constantly forgotten about are under. That's why a robust exit strategy is key, and it's much more than just vaccination. We can't keep blaming mutants and variants. We can't keep blaming the public. We can't afford any more deadly delays and incompetence. Responsibility lies squarely with the government at the government's door to deliver an efficient vaccination plan, improve test, trace and isolate, and communicate openly with the public.
We now go to Maria Miller.
Thank you, Madam Deputy Speaker. All governments have to make difficult decisions, but no other in peacetime has had to restrict our freedoms so profoundly. And our role as MPs is to scrutinise that. And I'd like to thank the Secretary of State, my right honourable friend, and his team for the briefings provided to all members with medical experts to provide professional interpretation of the data. That every person that we represent wants to know that action that's being taken today is absolutely necessary and that there's a clear way out so that people can get their lives back as soon as possible. The clear way out that my right honourable friend has identified is the vaccine rollout, that the UK has led the way in getting 2 vaccines approved and has had more people vaccinated already than all the countries in Europe pulled together, is a significant achievement. So again, I'd like to point out that paragraph 3.2 in these regulations needs some clarification because it changes the end date of the regulations to the 31st of March of this year, beyond the date when experts estimate that all those in the most vulnerable groups will have been vaccinated. Now, I understand the need for caution, but will that caution give room to delay? I know that isn't the Secretary of State's intent. So can he come to the House regularly to update us on the rollout of the vaccine programme so that we can scrutinise, raise issues with him that we encounter, and indeed perhaps identify more unnecessary red tape that needs to be removed? Now, when it comes to the sequencing of the vaccination, I think the government needs to look again at the priority given to vaccinating teachers in our communities. We know the damage done to our children's education through disruption. We know the pressure put on family life with schools being closed down. So in order to protect the ability of schools to reopen and continue to be open in the coming months and children's futures from more disruption, I believe that we need to think about putting teachers into that priority group. And finally, Madam Deputy Speaker, I'd like to take this opportunity to wholeheartedly thank the whole of our North Hampshire NHS team, our local trust and also Hampshire County Council and our amazing local borough council for the incredible work that they have done to help keep my community safe in the recent months. And it's with a heavy heart I support these measures, Madam Deputy Speaker, but we can be in no doubt at all that they are essential today.
We now go to Yvette Cooper.
Thank you, Madam Deputy Speaker. Cases in the Wakefield district have gone up by over a third in a week. They're still lower at the moment than in November when Pinderfields Hospital was pushed into crisis, but they're rising fast and none of us want to go through that crisis again. And that's why measures are clearly needed, but this is a really difficult time for everyone. And I want to thank the staff of Mid Yorkshire Trust, the NHS, healthcare staff, key workers, working non-stop to get us through this difficult time, who we owe so much. The community hubs we set up in Normanton, Pontefract, Castleford, Nottingley, supported by Wakefield Council, are working hard again with volunteers and neighbours helping each other. But we urgently need more support for businesses and families from government, especially those excluded from economic support from the start. And we need the rapid action to roll out the vaccine, and we need the programme to work, which is why I want to raise concerns about the potential threat to the vaccine programme from the new South Africa variant. Senior scientists have said this may be less susceptible to the vaccines because of the additional mutations. I know government is worried about it, but I do not understand why they are not taking urgent action to prevent the South Africa variant being brought into and spreading across the UK. Rightly, the government has stopped direct flights from South Africa, but the first wave shows that is not enough. Genomic evidence quoted in our Home Affairs Select Committee report in August showed 34% of imported COVID cases came into the UK from Spain, 29% from France, less than 1% came directly from China. So when the Prime Minister says that we've taken strong action by stopping direct flights, he's kidding himself. The South Africa variant is already identified in France, Austria, Norway, Japan, Australia. And currently our border checks are weak and not taken seriously. Travellers aren't tested before arrival or on arrival. Untested, they get public transport from the airport, pop into the shops to get milk before going home, and the checks on self-isolation arrangements are minimal. The Financial Times says the government's plans to introduce pre-travel testing have been delayed because the Transport Department wants UK residents to be exempt. Well, if true, that is ridiculous and dangerous because COVID doesn't discriminate and we cannot afford delay. Other countries have strict rules, including quarantine hotels, regular tests, airport testing, repeated testing, quarantine taxis with screens. Look at New Zealand, Australia, Germany, Italy, South Korea. The UK has to get serious about this too. And that means we failed to do that the first time round. And as a result, we face our third difficult lockdown now. We cannot afford further waves of this virus. We have to make sure we do not make those mistakes again.
Adam Holloway.
Thank you, Madam Deputy Speaker. Can I again congratulate the government on its amazing foresight in getting so far ahead of the game in terms of the vaccination programme. A few minutes ago, I spoke to a prominent Gravesend GP, Dr. Ruben Minhas. For the last couple of weeks, he and his team have been busy contacting local over 80s, booking them in and getting them into the surgery to get the inoculations done. But in order to do this, he's had to get all his staff on the phones, all the receptionists, husbands, wives, partners, to get, and this is having a real effect on the day-to-day work of the surgery. So perhaps the whip could pass on to the Minister. Perhaps we should be giving GPs a bit more help with bookings, especially since this is going to ramp up as more vaccine becomes available and we go to different groups. Throughout all of this, many people have been really quite heroic, especially all the people who go to work day after day knowing that they've got an underlying health condition that makes them particularly vulnerable to the virus. I can think of one head teacher in my constituency who's shown what can only be described as extraordinary bravery, going into school every day, risking his life. And we all know of people in our constituencies, tens of thousands of them perhaps around the country, who knowingly put their lives at risk every single day in the public sector, in the private sector, in schools and supermarkets, in hospitals and food packaging plants. And I'm glad such people will soon be inoculated. But I don't think it's right that there should be any particular acceleration for those working in particular settings like schools who are not in vulnerable groups. I think this would delay what the Prime Minister describes as the fire break, where we deal with the people who are most likely to die. That way, the deaths go off the cliff. I also think we need a can-do attitude from now. In rolling out this massive programme of vaccinations, I think it's critical that everyone in the public service shows the can-do attitude that we've witnessed from all the staff in Darren Valley Hospital who've been looking after my constituents over all these months. All of us in public service should be following their example to do everything they can do to get these first 4 groups vaccinated. And look, this is not the time for bureaucracy or finding reasons why something or other can't be done or it's just too difficult. I was horrified when I heard of one hospital who received 3,000 doses of vaccine on the Wednesday before Christmas and didn't start using it till nearly 5 days later. Everyone in this country, especially those of us paid from the public purse, must be treating this vaccination programme with the greatest urgency. This really is a national emergency, and there should be no room for anyone who's not now on a war footing to get these early groups vaccinated.
We now go to Jeff Smith.
Thank you, Madam Deputy Speaker. I'm going to vote for this legislation. It is sadly necessary, as today's awful COVID figures demonstrate. I want to speak briefly about how we help people get through the difficult period ahead as we vote to lock down the country today. If we're going to affect so many lives and livelihoods, if we're going to ask our citizens to help the nation by doing the right thing and making sacrifices, then we as a nation have to do the right thing by them. We need to provide the support people need to enable us all to work together to get through this. In the short time available, I'm going to mention 3 specific areas where we need to do more. Firstly, for businesses, especially small businesses and the hospitality sector. Business rates relief and additional grants are welcome, but for many businesses, their premises costs are the biggest burden. They still have to pay rent, and for many, it's unrealistic to think they can keep building up debt without some additional support. So can I urge the government to consider a scheme of shared rental burden, where the renter and the landlord, also the government and the banks or mortgage lender, all take part of the responsibility. The country bailed out the banks during the financial crisis, and they should step up and be part of the solution now. There are models elsewhere, for example in Australia, we can look at as a basis for this. Secondly, as I asked the Prime Minister today, so many people still aren't being helped by the Self-Employment Support Scheme. We've now had 9 months to come up with a plan to support these workers. People who've worked hard, paid their taxes, and now aren't getting a fair deal. There are potential solutions out there, and I'd urge ministers once again to look at the proposals from the Federation of Small Businesses, amongst others, to find creative ways to help people who are really struggling. Many of my constituents are self-employed, and many Mancunians work in our world-leading creative industries. Our festival industry alone is worth 1.7 billion to the UK economy and supports 85,000 jobs. Festival organisers are struggling to get insurance, and they're asking for a government-backed insurance scheme to enable festivals to be planned with confidence. Because if we don't help out, many will be cancelled in the ongoing uncertainty, and we'll miss out not on just an important cultural part of our summer, but the economic benefit that helps communities and supply chains across the nation. So please, I hope the government that will look positively on that. And finally, our councils have been at the forefront of this crisis, supporting people and coordinating services. The government said they'd give our councils everything they need to do that, but the overall impact of COVID-19 in Greater Manchester is £802 million this year alone, and government funding for the pressures is £404 million, leaving a gap of £398 million. And as a result, Manchester City Council is facing cuts in the region of £50 million this year. That's not sustainable. So I ask the government to fulfil their promises, give our local authorities the support they need to help us all get through this. Thank you.
Thank you very much, Madam Deputy Speaker. It's a pleasure to speak in this debate. I have not always been able to follow the government line through the division lobby when it has come to further restrictions, because I have felt that in parts they have not been proportionate when looking at the wider public health concerns and the operational state of the hospital and the concern as to our loss of liberties and making things worse. That situation for me changed, Madam Deputy Speaker, when the vote came for Tier 4 measures to be put into my county and other parts of the country, because I could see two things. Firstly, the vaccine in sight, so we don't have this perpetual lockdown situation. The end is in sight. And secondly, the hospital operational capacity is incredibly tight and on the edge. And I've just heard from my chief executive who tells me that she's got 50% of her beds with COVID patients and all the ICU units are full. So things have changed, but I believe that we are in the final chapter if we can deliver the vaccine programme, and that's why I will be voting with the government this evening. I never thought I would see the day when I would be voting through a division lobby to see pupils denied their right to attend school, but I do feel it's absolutely vital. I just want to make one point about the cohort of those being vaccinated. It makes no sense at all to give a vaccination to a 40-year-old teacher rather than that teacher's 80-year-old mother. If you do so, you may be in the situation where, firstly, that 40-year-old teacher, whilst being vaccinated, can still transmit to the 80-year-old mother. But with the vaccine in short supply, it's the 80-year-old mother that is in danger of losing their life. And that is what keeps us in lockdown. So we will never reopen the schools if you end up vaccinating the teachers and not that cohort. I really wish honourable members on both sides of the bench would really see that argument as the best way to get the schools open again. The other message I want to make is for young people. Rightly, people have talked about the concerns of young people on their mental health and the challenges, and I feel that too. But I really want to make sure that young people are not seen as victims. We don't make them become victims. This can actually be their defining moment where they give something back to the generations that went before them. It will be the sacrifices that they make that will actually save lives. And we must make sure that we put something back. So for those older generations who are having the sacrifices made by the younger, ask yourself, what can you do to counsel and pass on wisdom to help young people catch up in school? What can you do to offer an apprenticeship to a school leaver? And what can you do to really make sure that those young people have the confidence to feel that they have achieved great things by making a sacrifice, as those did during the Blitz years? And to all those young people, I say, you will come through this stronger. We will make sure you are rewarded, but please don't be defeated by this pandemic in the way that we will not let older people be killed by this pandemic.
We now go to Stephanie Peacock.
Thank you very much, Madam Deputy Speaker. This new lockdown is a position that none of us wanted to be in, and I begin by paying tribute to all of our key workers. Whilst there is a light at the end of the tunnel with the vaccine, this government's inability to react quickly and with clear leadership has meant that people have lost their lives and livelihoods. The former Conservative Chancellor, George Osborne, was right when he wrote yesterday, "In hoping for the best, we have failed to prepare for the worst." The government must not waste the time given to them in this third lockdown. The vaccine programme must be delivered with the speed and efficiency that people have been promised, alongside an effective test and trace system. The economic impact of this crisis has been catastrophic. In Barnsley East, over 3,500 people are now recorded as being on universal credit. Unemployment has risen, and the local food bank has seen demand increase by 300%. This is unacceptable and avoidable. The level of statutory sick pay in this country is completely inadequate. The UK currently falls behind the standards set by some of our European neighbours. If you're a higher earner and your wage is cut due to sickness, you're more likely to be able to absorb the financial blow. Statutory sick pay is currently set at a flat rate of £95.85 a week. If you earn minimum wage or are on a lower income, how are you meant to cope with such a reduction? You can't choose to pay less of your rent, mortgage or bills. The UK is one of the very few European countries that still pay sick pay in this way. Now, I acknowledge the government introduced a one-off payment for people isolating on low incomes, but there is a lot of evidence to show that it isn't working and too many people are still falling through the gaps. Take, for example, the man in Barnsley, who when asked if he would isolate if he was contacted by Test and Trace, he said no, probably not. And when asked why, he explained, if I don't work, my family don't eat. People want to do the right thing, but simply cannot afford to. Proper statutory sick pay would make it much easier for people to take a test and isolate. And it is absolutely crucial in stopping the spread of this deadly virus.
Walker.
Thank you, Mr. Deputy Speaker. Mr. Deputy Speaker, I can't support this legislation tonight. I can't support criminalising a parent for seeing a child in the park over the coming months. It's not within my DNA to do that. But, Mr. Speaker, of course I will follow the law and respect the law. You have the argument in the House of Commons, you divide, you're on the winning side or the losing side, and I will be on the losing side. There is no doubt of that. But I do not wear the fact that I will support the law with great virtue, because it's so easy for me to comply with the law, isn't it? It's so easy for most people in this house to comply with the law. We're comfortably off. We live in nice houses. We have gardens. We have outdoor spaces. We have access to family. The same applies to those journalists who fill our TV screens every night with their wisdom and wit about how people should comply with these regulations and how they sneer at those that can't. But Mr. Speaker, Mr. Deputy Speaker, the next 3 months are going to be really, really hard for a lot of people who don't have my advantages, my advantage of a monthly salary, a monthly pension payment. These are people who are going to be worrying about their jobs, about their future, about their mental health, about their family relationships, because they will miss people terribly, or they will be in very small environments where apparently they can only leave to exercise once a day, and then sadly some of these people are going to break, and it's going to be too much for them. And that is when we in this place, the journalists up there with all their privileges, instead of sneering and dismissing them, instead of calling them COVIDiots, should show some compassion and understanding, because we should wear our advantages and privileges with great humility. I don't want to hear from another constituent who's having a good lockdown. I'm really pleased that you are, but my voice is for those who aren't, for those of my friends and neighbours and constituents who are struggling day in and day out, whose mental health is not in a healthy state but has deteriorated, who are wondering how over the next few months in the middle of winter they are going to cope with this. So in my remaining remarks, can I just ask colleagues, can I just ask people out there who are so fortunate to show some compassion and understanding for those who are not so fortunate?
Video link. Bell?
Sorry, thank you. It's been nearly a year since we've begun both being aware and dealing with this pandemic, and no one could have predicted it. We accept that. But the government, after this whole year, keep getting this wrong. In the 6th largest economy in the world, we have no excuse for the worst per capita death tolls, one of the worst per capita death tolls, and no excuse for one of the worst economic outcomes. We do need a national lockdown, but the only reason why we're having to lock down yet again is because every single lockdown has started too late and been lifted too early. So of course we haven't been able to get control of the virus, and of course the lockdowns have had the minimum effect because of how they've started. We haven't gone far enough. We know what needs to be done, and before we can get back to normal, we need to focus on bringing the infection rate down. And unfortunately, so far, it doesn't seem that the government have committed to doing this. We need a strong elimination strategy that drives cases down. We're at 1 in 50 in this country and 1 in 30 in London, where the House of Commons are infected with the coronavirus. And that makes me beg the question, how many people on the estate at the moment could possibly have the virus? It's been far too long looking at how successful people have been in other countries and not thinking to ourselves that we should also adopt a zero COVID strategy. And that strategy needs to be complete if we are to see the R rate go down. So yes, we need this lockdown, but the government cannot keep asking people to give up their freedoms and their livelihoods and not stand by them. Because yet again, the support measures do not, and they have never fully met the needs of this country. Again, after a whole year, the government have failed to provide for the 3 million excluded from all government schemes. We need an effective track and trace system. We simply don't have it. We need more funding for charities and local authorities who've been dealing with the brunt of the virus. We need rent relief for tenants, a ban on evictions. We need an increase on statutory sick pay, and we need laptop and a broadband for every single child that needs it. Whilst the vaccine is very, very welcome news, the success of the lockdown cannot be measured by the vaccination programme alone, especially because of how long it's going to take to get it to the entire population. So again, we need to focus on bringing the R rate down, and we need to look at these measures properly before we begin to release restrictions, because we cannot, after an entire year, keep making these mistakes again and again. It is costing lives, it is costing livelihoods, and so far it's been a complete and utter shambles for which this government has no reasonable excuse. Thank you.
Thank you. Video link. Sir David Evenett.
Thank you, Mr. Deputy Speaker. I strongly support the government's policies and these new public health regulations brought in to help defeat this dreadful coronavirus. Regrettable, but absolutely necessary and requiring compliance by us all. I commend the Secretary of State for all his work, hard work and determination during the past 10 months, and also for his briefings on the issues. The Prime Minister, I know, regrets the need for these lockdown measures, but he had no choice because of the seriousness of the situation. I'd like to begin by paying tribute to Bexley Council for all their tremendous work, and for all the local NHS staff across South East London who worked for so long and so hard during this national crisis. Also the community workers who've done such great service across my borough to help the most vulnerable. I'm of course extremely concerned about the rising infection rates in London, and particularly in my borough of Bexley. The new strain of the virus has had real and detrimental consequences for my Bexley Heath and Crayford constituency, not just the spread of the virus, but also the curbing of liberties, the closure of clubs, businesses and shops, and of course, those who tragically have lost their lives to the virus. To prevent the spread of the virus and further deaths, these measures are essential. I'd like to also highlight the growing concern of mental health issues in my area, particularly those living in overcrowded homes and small houses, living alone, the elderly and the disabled. The closing of schools, of course, is regrettable, and there will be education consequences. However, this crisis needs strong action, and restrictions are necessary to safeguard the vulnerable, and with the vaccination, help beat the coronavirus. My third point is really the matter of vaccinations and the opportunity for retired GPs, nurses and pharmacists to assist in the delivery of this massive project of mass vaccination. I've been given examples of people offering their services, but either have been given a plethora of forms to be filled in or have not received any response to their offer of help. This has been disappointing, but today I do commend my Right Honourable Friend Secretary of State's actions to cut the bureaucracy and increase the vaccine rollout. I also welcome his comments about Sunday vaccinations. These comments need to be widely publicised to increase public confidence. These facts need to be known, and my constituents are obviously looking for regular updates on the progress of vaccination and hopefully when the lockdown will end, an exit strategy. But in conclusion, I share my Right Honourable Friend's determination to have a vaccination, roll out and support these new public health measures. My constituents will also support them, and it's necessary to save lives and defeat COVID-19. We need to get the vaccination done.
Link. Janet Davey.
Thank you, Mr. Speaker. I'm grateful to be able to speak in today's debate, and I would like to start by extending my deepest sympathy to my staff member, Rosina, who today lost her mother to coronavirus. Words cannot describe the devastation this virus has caused to so many. Mr. Deputy Speaker, there are so many concerns I have with the impact of the government's handling of this pandemic, and there are too many pressing issues in Lewisham East to mention, but today I would like to raise the crisis facing our ambulance services. I've been speaking with a constituent of mine, Mr. Clive Toombs, who is a technician in the London Ambulance Service. Mr. Toombs told me of the sheer stress level he and his colleagues are experiencing. As a secretary for his branch for GMB Union, Mr. Toombs speaks not just for himself, but for thousands of members serving the capital. Staff sicknesses in the ambulance service is at an all-time high. Mr. Toombs estimates around 6,000 staff across the service are off sick, the majority with COVID-19. He has lost colleagues to the virus and other colleagues are hospitalised. Many others will understandably be suffering from declining mental health after seeing the very worst of the impact of this virus and that which it is having on our people. PSD is also becoming commonplace. Phone operators are having to play God in choosing who amongst the hundreds of callers will get an ambulance. Mr. Toombs also speaks of the relentless shifts that those in the ambulance profession are working. Those on the front line are working 12, 13 hours and sometimes 14-hour-long shifts, and all too often they don't get a rest or a break before starting their next demanding shift. Mr. Speaker, we cannot expect our ambulance service to work all hours of the day and night, providing high-quality care, think quickly and making smart decisions and putting themselves in danger without having enough time to rest. I'll be grateful to hear from the Secretary of State for Health on this issue. Many of us have been distressed by images over the Christmas period of ambulances piling up outside hospitals, particularly in London. Every one of those ambulances has someone who is in urgent need of medical care, and some of them, their lives depend on it. A&E departments are not able to keep up with the level of demand, and so ambulances with patients in them have to wait for hours upon hours, up to 11 hours, Mr. Toombs says. They wait on trolleys that provide them little comfort, only meant for short use. Staff sit with them in vehicles but struggle to provide safe ventilation in the cold weather. There is no access to a toilet or a wash basin in an ambulance. None of us would like to imagine our parents or partners or elderly neighbours or loved ones suffering in an ambulance trolley waiting to be admitted. But what's more, Mr. Deputy Speaker...
Order. Sorry, Janet. Time's up. I apologise. Siobhan Bailey.
Thank you, Mr. Deputy Speaker. There are 100 things that I could rise to stand up for Stroud about today, but given the shortness of time, I will focus on education, exercise and entrepreneurs. And firstly, I want to say that I will be supporting the government tonight. I am clear from speaking to the Gloucestershire NHS and health teams that our hospitals and key workers are under extraordinary pressure. Life would not be normal and local businesses would not flourish if ambulances were queuing around the Gloucestershire Royal, or if worse still, images of body bags were filling the news like we saw in other countries. I accept that drastic action is needed right now, and it is for all of us to work together to get out of this lockdown with the can-do attitude and compassion shown by my friends on either side of me from Gravesham and Broxburn. But Mr. Deputy Speaker, I thought that we had reached an understanding that education needed to continue. In the first lockdown, 55% of teachers in the most deprived areas suggested students were learning for at least less than 1 hour a day. Eating disorders are now on the rise and mental health issues are rife. We have to be honest, there is simply no replacement for face-to-face teaching. No amount of money or whizzy technology or free devices will bridge the education gap that the COVID pandemic has created. Children need time in school and they need their families who are not fraught from juggling homeworking and homeschooling and worse. Stroud teachers are also phenomenal and have already jumped through extensive logistical hoops to get our schools COVID safe. I ask that the government helps to reopen schools without delay and does not let children get caught in political games. On exercise, I want to see gyms, park runs, fishing, clubs like golf, tennis, archery and swimming open ASAP. Living with excess weight puts people at greater risk of a serious illness or death from COVID-19. Government guidance says look after your physical well-being, your physical health has a big impact on how you're feeling emotionally and mentally. So why, Mr. Deputy Speaker, cut off businesses that effectively help us fight COVID and protect our mental health? Do not get me wrong, the rise of walking, running, cycling and online classes is positive, but please don't underestimate the benefits of gyms and sports clubs. The professionals who work in these places know their health and mental health onions, and we need them to survive, to produce the healthy society that we know is necessary to cope with COVID now and prosper in the future. And please, on entrepreneurs, will the government look urgently at the camera campaign surrounding the sale of takeaway alcohol as per my Prince Albert pub in my patch? They brilliantly pointed out that it's not fair to stop this activity when supermarkets and off-licences can sell regardless. I'd be relentless on the plight of the wedding and events industry. We need a roadmap and pilot studies in Stroud, and our fantastic limited companies who reside in Stroud. It was wrong to not give them support when the virus was going to be gone in a few months, and it's wrong now.
Video link. Ian Byrne.
Thank you, Mr. Deputy Speaker. Infection levels in Liverpool are now higher than in the second peak in October. This is why local leaders call for an urgent national lockdown to try and control the spread of the virus and to prevent pressure on our hospitals, which I fully support, along with a rapid increase in vaccinations. I've just been on a call with head teachers from SEND schools in my constituency, and I want to ask the Secretary of State at the outset, and I cannot stress this enough, that teachers and teaching staff are offered vaccinations as a matter of urgency. They are still out working on the front line, and they need these now. The government must also address inequality at the same time as implementing the third lockdown. And I will now turn to some of the many other issues that my constituents in Liverpool West Derby wrote to me about, which must be urgently tackled. Firstly, access to food. There are 10 million people in the UK living in food insecurity, many of which are queuing up at food banks. We've seen pictures on Christmas Day in Newcastle. The government must step in to support, and it must cancel its planned £20 a week cut to universal credit and bring in the right to food. Next, financial support. Mr. Deputy Speaker, one of my constituents, Martina, who was self-employed, has now gone 13 months without any pay. Where is the Chancellor today, and where is his financial plan to support people in Liverpool? On top of this, there have been many punishing job losses from rogue employees. Harrowing examples include the pernicious use of firing me hire by BA and British Gas, and the treatment of a loyal workforce by Rolls-Royce of Barnoldswick. The government must step in and fight for them and outlaw this pernicious practice which drives people into destitution. I must also mention support for renters and the homeless. Many renters are faced with huge arrears and have been forgotten by the government. They must now support renters and at the very least extend the eviction ban beyond the 11th of January. And unbelievably today, we heard the Everybody In scheme, which rightly has won praise, will not now be continued in the depths of winter and a virus out of control. Even before the pandemic, our communities were facing a crisis of low pay, insecure work, food and fuel insecurity, unaffordable rents and cuts to welfare and services. So many people are already at a tipping point, and the pandemic has pushed more into unimaginable levels of hardship. Inequality and poverty are not inevitable. They are as a result of political choices made by this government and can be solved by a government with the will and the moral fortitude.
Sir Robert Sims.
Thank you very much. This is a difficult crisis for the government, and no doubt the Prime Minister and the Secretary for Health must have constitutions of an ox to deal with the very difficult decisions that they have to do every day. But I'm afraid I can't support this legislation today, and the principal reason is at the end of last year I thought we'd got to the point where Parliament would be consulted on a regular basis. And we have regulations today which set out the 31st of March, which is a full 3 months. And although we've had warm words about, of course, we're going to review when we come back to discuss with Parliament, as of right, we do not have any ability to influence this once it's passed. It's essentially a blank cheque of 3 months to Public Health England to do what they wish. And that's why I worry about the legislation today. If the legislation said a month and a review, or a month and a review, I might even be tempted to vote for it Mr. Deputy Speaker. But the 3-month nature of the regulations seem to me too long and I don't think are proportionate to where we are. Parliament's sitting. The reality is we are here, so we need to be involved in these decisions. I notice regulations have been passed so that if you sit by a river with a fishing rod, you are breaking the law under the current lockdown regulations. People will follow sensible regulations and they feel it saves lives. But the bureaucratic nature of this essential lockdown is, I think, such that people will get frustrated and they may well actually break the regulations because they can't understand why they are there. So we need these reviewed, we need Parliament involved, we need the government to listen. I was somewhat concerned earlier when the Secretary of State was talking about when this would be lifted. We need a programme. We need the criteria for lifting. Is it hospitals? Is it infection rates? Is it deaths? Is it all the vulnerable people actually inoculated? But we heard earlier, once they're inoculated, the government would think about it. And I have businesses in my constituency. I have people work. I have people trying to pay a mortgage. People work for generations sometimes, and certainly for decades, building up businesses. And they are being closed down, and they may not survive. Taking away the freedom of people to trade is a very substantial thing to do. And there are some people who will not survive the regulations and the way in which we're locking them down. And that's one reason why I'll call a vote tonight. I think if we are going to take away people's liberties and freedom, let's do it with our eyes open with a vote of this chamber. Because I feel very queasy about destroying people's livings in my constituency when people work so hard. The people who make these decisions are superannuated, pension, public sector, safe. They can retire. In my constituency, there are people who don't have these advantages.
Video link. Daniel Zeichner.
Sadly, the new restrictions are as inevitable as they are necessary. The government says that it's a new variant that's to blame for the problems, but frankly, it's been obvious for months that the NHS was going to come under huge stress during the winter. And I think it's time for less flowery language from the Prime Minister. Too much bluster, too much over-optimism. Frankly, we're all tired of it, just as we're tired of the lockdown itself. And the chaotic way in which the latest measures have been introduced have caused particular and understandable fury because it was all so unnecessary. Leaders in educational establishments in Cambridge have been left in an impossible position. On Monday, trying desperately to set up the testing measures demanded by government, trying to reassure pupils and parents that they'd be open the following day, only to get texts and emails late in the evening completely contradicting the previous advice. And now they're suddenly expected to be able to switch to delivering teaching remotely. BTEC exams in FE colleges having to be cancelled at the last. And in schools, well, the front page of today's Cambridge Independent newspaper tells us a story. A disgrace, say teachers. The head teachers at St Matthew's in Cambridge, Tony Davis, describes a day of chaos. And as he observes, so much heartache could have been saved if the decision had been made in a timely manner. And Niamh Sweeney from the National Education Union rightly observes that because of the chaos, the government has jeopardised public health. In education, the problems go further still. While local education authorities like Cambridgeshire have stepped up, they are hampered by the patchwork of competing governance arrangements now in place. They can advise, but for multi-academy trusts, the decisions in some cases are made far from Cambridgeshire, out of sight, beyond local scrutiny or influence. And the diminished powers of local authorities, particularly second-tier districts, are brought into stark focus when councils like Cambridge City find they do not have the powers they need to deal with public health hazards. The temporary closure of Cambridge Market is a case in point, where lack of the precise powers needed have led to an overall closure that no one wanted. So I will support the legislation today, but I also highlight another area of government failure. We've heard a lot about testing, a lot about vaccination, but precious little about isolate. Behavioural scientists advise that people do what they are asked when they're motivated, have the opportunity and the capability. Sadly, the government has failed to motivate. It hasn't celebrated those who do and hasn't ensured there's the opportunity through providing accommodation or the right financial support. That's why it hasn't worked. I drew the Secretary of State's attention this weeks ago when I learned that just 14 people in Cambridge had taken up the offer of financial help to isolate. The Secretary of State kind of shrugged. And it's that kind of failure from government that means the situation we're in today was not inevitable. It could have been different. But this is a government unwilling to acknowledge mistakes or learn from experience. We're all at risk because of it.
Video link. Pauline Latham.
Thank you, Mr. Deputy Speaker. Well, the COVID has outwitted us again. It's come back with vengeance and it's hitting many, many people. It's affecting the hospitals to such a degree that the tired nurses and the tired doctors who've been working relentlessly are struggling. So we have to do something about it. But is a lockdown the answer? We've locked down before and the figures have gone up. The answer is vaccinations, as we've been told by many people. Vaccinations are the cavalry, but this cavalry needs to come fast and it needs to come with great ambition. We need people to be out there vaccinating, and I'm delighted to say that one of the volunteers who couldn't get through the form has now been accepted because she's not had to go through the form. She's been accepted because she's a recently retired nurse and she wants to help, as there are many people who want to help with this vaccination programme. We can ramp up those vaccinations once we've got the vaccine in place. And I accept with the new vaccine it'll take a while, but it needs to ramp up. We need big ambition, not 2 million a week. We need at least 4 million a week. But what worries me is the Secretary of State and his opposite number on the Labour front bench both seem to think that even though we'll be vaccinated, we might not be able to go out. I did ask a question yesterday about an 82-year-old couple who haven't seen their brother for 9 months at least, and they want to go and see him. They're about to be vaccinated on Saturday. They want to wait the requisite 3 weeks and then go and visit the brother, who's also in his 80s and will also have had the vaccine and will have waited the requisite time. But I'm told that they can't do that. Now, if we are told we have to lock down and the cavalry in the terms of the vaccine is coming, we have to have some hope that we're going to be able to go out and we are going to be able to resume some sort of normality, that schools can go back, that businesses can operate normally. Otherwise, we're just going to be in lockdown for months and months and months more. Now, that might be what some people want, but it isn't what I want, and it's not what my constituents want. They want some freedoms, and we have to have those. So let's get the vaccinations out. Let's use every community pharmacy we have. Let's use every single St John's ambulance person there is. Let's use everybody who is qualified to be able to do that vaccine, and let's get those vaccines out fast. And let's get people moving so that we can make the most vulnerable safe so that they will not block up the hospitals, and then we can relieve the health service for what it needs to do, which is routine work.
Video link. Clive Betts.
Thank you. Thank you, Mr. Deputy Speaker. I'm going to support the proposals tonight because of the pressure on our NHS, and the briefings I've had from the Hospital Trust in Sheffield is to protect the health service workers, but also those patients who need cancer and other treatments, which they won't get unless we deal with this matter urgently. The Clinical Commissioning Group and GP Practice in Sheffield are enthusiastic, ready and willing to get this vaccine delivered. They tell me that within a couple of weeks, there can be up to 30 to 40,000 vaccinations a week in Sheffield, so that by Easter, a majority of the population will be vaccinated. The two caveats are, first of all, they need the vaccine delivered. And already we've had problems. I'm told that some of the primary care networks this week were told that the vaccine will be delivered on Friday. It arrived yesterday. So the practice have to scramble around to get people to come in at very short notice to deal with the vaccinations within 3 days. Other practices were told that they would have the vaccine this week, and then were told it wouldn't arrive till next week, having had the appointments made for this week for people to come in. That's not acceptable. It needs to be sorted out. The second one is the bureaucracy. I was pleased that the Secretary of State earlier said he was going to strip out the training requirements for people giving the vaccine. Absolutely right. They shouldn't have been there in the first place. I'm told that it will take about 8 minutes to do one of the COVID vaccines, compared with 2 minutes for a flu vaccine. Why is the difference? It shouldn't be there. There are actually guidelines in the rules that have been sent out to explain how GP practices should cut up the waste packaging once the vaccine's been delivered. It's this sort of bureaucracy and nonsense that we need to sort out. I've also been told this week that when I asked for information about which GP practices would be giving the vaccine for the first time this week, I couldn't have that information unless someone higher up in the NHS approved it. Sorry, I'm entitled to the information. More importantly, the public of Sheffield are entitled to that information. We need to stop that bureaucracy as well. Finally, can we stop passing regulations that can't be enforced? The wearing of face masks, very important. But if people simply say, as I met a group of young people, saw them in Meadowhall Shopping Centre the other day, walking along saying, oh, we'll just tell them we've got asthma if anyone asks us. We need the police to have the powers to make people wear a face mask and be required to produce evidence of an exemption if they have one. Finally, recently, Derbyshire and Nottinghamshire were in Tier 4, Sheffield was in Tier 3. People were driving over the border to Meadowhall and Drake House to do their shopping. The police had no powers under the rules to enforce the requirement that people shouldn't travel over the border for those purposes. We need to sort that sort of situation out as well.
Sir Robert Neal.
Thank you, Mr. Deputy Speaker. We should only vote to pass legislation which severely restricts the freedom of our fellow citizens and the legitimate activities of lawful business if there is the most compelling necessity, and if those measures are proportionate, and if there is proper parliamentary scrutiny and oversight. On balance, and having seen my own constituency and the data relating to it, the exponential growth in infections caused by the new variant of the virus, on balance, I am persuaded that there is a compelling necessity for these regulations. As to proportionality, again, on balance, I think, even regrettably including the closure of schools, there is evidence to support the bulk of these measures. But there are, inevitably, I think, because they were produced in haste, some elements which, frankly, fly against evidence and reason and need to be reviewed and reviewed swiftly. The obvious example is the prohibition upon two people in the open air playing golf or tennis. There is no rational basis or evidence for this. It's a mistake to include them, and it's very clear that it's not necessary in Scotland. They haven't done that in Scotland. I don't think it's safe north of the border and unsafe south. That also creates a problem for many local authority leisure centres who are struggling for income. That ought to be revisited. Similarly, the disproportionate effect of the ban upon alcohol off sales on micro pubs and small independent public houses, as opposed to the off-licence chains, ought to be revisited. That brings me to the point about parliamentary scrutiny. I'll live with those flaws in the regulations for the broader good if there is timely scrutiny and review. Leaving it 30th March without any review would be unreasonable. I welcome the fact the Prime Minister said earlier today that there would be the intention to bring matters back to the House as the vaccination programme proceeds. He also said that there was a legal obligation to remove redundant restrictions in the regulations as the vaccination programme proceeds. I hope the Minister will indicate what the mechanism is for that, because an obligation has to have a means of being enforced. In that instance, that means coming back to this House. If we can have that, then on balance, I could give these regulations my support, which has not been the case in previous instances. But we cannot use the gravity of the situation as a reason to overrule the normal requirements of proper parliamentary scrutiny. That is necessary in the interests of democracy and of the rule of law. I hope that the Minister will be able to give me those assurances as she winds up the debate.
Video link. Paul Blomfield.
Thank you, Mr. Deputy Speaker. And let me start by saying that I will support these measures today, simply regretting that the government is acting too late again. Clearly, these measures are necessary. So is the support for those whose lives are being affected by them. Ministers will know that too many have fallen through the gaps in the support schemes provided by the Chancellor, particularly in small businesses and among the self-employed, and especially in my constituency in the hospitality and creative sectors. I haven't got the time today to discuss all the ill-considered rules and deadlines, but I would ask ministers to agree to meet representatives of the excluded, along with those honourable members who have taken up their cause. So often in a crisis, it's those who have least who've been hardest hit by COVID. The government could begin to address this unfairness by making a commitment today that the temporary £20 a week increase to universal credit and working tax credit will be made permanent from April. Also to commit to extending it to the legacy benefits, ESA, income support, JSA. Mr. Deputy Speaker, this is a moment to pay tribute to the key workers who have kept the country going and who will do so in the weeks and months ahead. Let's remember them as we move forward too, by tackling the low pay and fragile employment faced by too many of those in the private sector. And let's give those in the public sector the pay increase that they deserve, not the pay freeze that they don't. So much now depends on the vaccine. Let's remember that the first vaccine to enter British arms, which we should celebrate, was developed by Turkish origin scientists in Germany with an American company and manufactured in Belgium. An international response to an international crisis. I hope that will be reflected in our response more widely as a country. And I hope that ministers will confirm that as we roll out the vaccine in the UK, they will work with our partners around the world to ensure it also reaches those who desperately need it in low-income countries. Mr. Deputy Speaker, in agreeing to these measures today, let's also resolve to tackle the injustices that have been highlighted by this crisis.
Thank you, Paul. Video link. Caroline Oates.
Thank you, Mr. Deputy Speaker, and I welcome the opportunity to contribute this afternoon. We've heard a great deal of consensus across the House. We know there is a terrible toll on people, on our constituents, and every member who votes in favour of these regulations tonight does so with a heavy heart, balancing the impacts carefully and with recognition that they must be, for a minimum period of time, reviewed frequently, carefully monitored. We've heard from many speakers about the impact on children. My friend, the Honourable Member for Harlow, highlighted the terrible lockdown that the loss of social interaction is having on young people and their mental health. I was pleased to hear from my Right Honourable friend, the Prime Minister, earlier today that getting schools back is an absolute priority. It must be. And teachers, parents, school children themselves have reached out to me asking that I highlight their worries, as have the early years sector, who feel that they have not been taken with the government and have been neglected over the course of the last few days in announcements. I called back on the 12th of November for teachers to be prioritised for vaccination. Now, I recognise there are competing calls from all key workers, but I would like to make particular reference for those working in special schools where there is a very great need and where it is hardest for children to understand the importance of social distancing. Equally, there must be vaccination for care workers working in domiciliary care, employed by charities or working independently. And this afternoon, Age Concern Hampshire have highlighted to me their worries that these workers are going to go unvaccinated. The death toll for those with learning difficulties has been horrific. And the Honourable Member for Lewisham has highlighted the work my committee has done on this, publishing a report on the impact of COVID on those with disabilities. The commitment to rolling out information in a manner that can be easily understood, whether it's easy read, large print, Braille, British Sign Language, has been quite inadequate. As a result, people who need the most help have had an information gap, and that is not good enough. Gov.uk still does not have a BSL translation when there are apps that could do that quickly, easily, and relatively cheaply. But it is not just those with learning difficulties who have not been given enough information. Members of Parliament this afternoon have asked for additional details about the agreed schedule of vaccine delivery about the approach to the equation between numbers vaccinated and a consequential lifting of restrictions. People have shown their willingness to comply with massive restrictions, but they want to understand the exit strategy. Early years providers want to know that they are as valued as primary schools. Golfers want a clear explanation why a walk with your partner with no clubs is fine, but with your clubs is not. People are not fools. The science is difficult and graphs can be bewildering, but ministers need to give us transparency and honesty. That is the key.
Link. Karen Smith. Mute. Karen, you're on.
Thank you, Mr. Deputy Speaker. Retail, hospitality, care, building and trades are the biggest employers in Bristol South. There have been many job losses, but many people are working in those industries and they are keeping our city going. They have done everything the government has asked of them, and we now need to make sure they are safe and get this vaccine delivered and open our economy. Now, I've worked for many years with local GPs and the NHS in this city, and I know them well, and I've worked very closely with the team at Ashton Gate Stadium who are on standby to deliver this vaccine. We have a good standard of general practice in South Bristol, good collaboration. They've already started, and Ashton Gate have been ready for weeks, but they are all being kept in the dark somewhat about what the expectation upon them is and what is happening nationally with the rollout. So we have some basic questions that we'd like the Minister to answer, and they're basic project planning why questions. We know why we're doing this, but providers locally need to know what vaccine is coming. They need to know who, for example, is going to the GP. How far down the JCVI list do we want GPs to do? How do we want to call them? Now, I think it's sensible to do the over 75s, care homes, and maybe the clinically vulnerable. But GPs, if they are going beyond that list, need to know, because basically they need to get back to their day job. We need to know where people are going to be vaccinated. Are the rest of us going to our GP, or are we going to Ashton Gate? We need to know when we're going. Now, I understand the reluctance of ministers to commit to dates, and this is a complex manufacturing, distribution and delivery process. But I agree with the member for Forest of Dean and Sheffield South East about transparency. And crucially, those delivering the service need to know. And absolutely, we as MPs on behalf of our constituency need to know when this is happening. Now, I've done a back of a fag packet estimation. South Bristol has got about 16,000 over 65s. GP practices can do roughly 500 to 600 of these a day. So in roughly 30 days, if we know when this is being delivered, we could vaccinate all those over 65s on South Bristol, but it does depend on knowing when we're going to get the vaccine delivered and what the expectations are upon the deliverers. I will support these draconian measures tonight, but I do not want, again, the government to impose upon us here in Bristol the disaster of the national one-size-fits-all, crony-backed whack-a-mole nonsense that we've had from the government. Our local CCG is doing a good job. We've got good collaboration on the ground in South Bristol with GPs and with the people at Ashton Gate Stadium. They know what to do. They need support and they need clarity to get on with it and make our city safe to resume our normal working lives.
Sir Desmond Swain.
Mr. Deputy Speaker, this is a situation of state capture. The government is completely in thrall to a lobby, driving a policy that has manifestly failed. It's failed, or we wouldn't be here yet again. A complete failure. And yet we go through increasing iterations of this policy with ever tighter controls and restrictions in the hope that it might finally work. And then, when there is a possibility, as a consequence of the arrival of the vaccines, the crazed lobby has already begun to signal that the social control won't be over, that some restrictions will remain. Indeed, the chiefs have pointed out that they might have to be reimposed all over again next winter. So, for those colleagues who are contemplating voting for these measures this evening, buoyed up by opinion pollsters telling them that actually the voters are in favour of them, and indeed the voters crave for even tighter restraints on their liberty, I would point out that when the devastating economic consequences of this policy come home to roost, double-dip recession, years of slow growth because firms can't take up new opportunities because they're saddled with debt, those same voters who were so enthusiastic will abandon them, and they'll be back to point a finger of blame. And on that occasion, at least, they'll be right.
Definitely not on mute, Sir Desmond. Video link, Ian Paisley.
Thank you, Mr. Deputy Speaker. I have consistently voted against these restrictions because I will not be dragged behind the banner waivers that take us into this cul-de-sac that we have been marched into. The Health Secretary at the beginning of tonight's debate said that, and I quote him, he has certain knowledge that we have a way out. Oh, if that were so, I would follow him gladly. But I don't actually believe the Secretary of State does have certainty that can be relied upon in terms of this virus. I mean, will this virus mutate into something worse? Who knows? Will the current vaccines work on mutated strains? Who knows? Can it be transmitted by asymptomatic carriers? Who knows? How effective are the current vaccines going to be? Who knows? What are we left with? Well, we're certainly not left with certainty about the way out of the lockdown. I've now lost count, Mr. Deputy Speaker, of the number of lockdowns that I've been asked to support by this government. The problem for the government is this. When this lockdown drags on through February and into March, and it still hasn't worked, what's the government going to do for its encore? What's next? I fear this is a massive mixed message. On the one hand, we have the wonderful news being declared that we've got a vaccine. Indeed, we've got 2 vaccines. And then, instead of committing to rolling that vaccine out in a very, very strict and fast way, we actually have a declaration that we need to go into lockdown. Now, that is hardly a vote of confidence in a vaccine. If on the one hand we're saying we have a vaccine, on the other hand we're saying we need to have a lockdown, we need to offer this vaccine urgently and quickly to key workers, whether they be in the health service or the education sector. We need to give it to the vulnerable and the elderly who are the target for this disease. And I think we should be using, Mr. Speaker, the army to roll out this vaccine in a very consistent way. Finally, I'm really appalled at the way in which our health service has been managed throughout all of this. It receives vast resources. And yet my heart goes out tonight to the 1,300 or so people in Northern Ireland who will not be diagnosed this year with cancer because they are too frightened to go to the hospital. Of all the other misdiagnoses in terms of coronary heart disease, in terms of stroke disease, because of the total absorption that the management and the health service has taken up with regards to COVID. I agree with my colleague for Strangford. We should have a national day in prayer for this, and I welcome the fact that the front bench of the Labour Party has supported that tonight. Let's put this rather embarrassing episode behind us of unending lockdowns, and let's get on with ensuring that the health of the nation comes first.
Video link, John Redwood.
I am very worried about the loss of liberty. I'm very worried about the economic damage. I'm very concerned about all those small businesses that have been shut down and their livelihoods undermined. So I do want the government to come forward with a more urgent, convincing exit strategy from these measures. And I do think we are owed more debates and more votes long before the end of March. We need to keep this under constant review and to keep the pressure up to take off those measures that are not strictly necessary or can be superseded by something better. I do hope the rollout of the vaccine will go well and will be speeded up. And I would like more information from the government on why they're not currently using pharmacies, why it has taken so long to welcome back recently retired people into the health service who would like to help out, and whether there is going to be a plan to train suitable volunteers so that we can greatly extend the numbers of people administering the vaccines. I also think it'd be helpful to know more about the supplies. But I also think we need to get smarter at living with the virus, because clearly, unfortunately, we're going to have to live with it for some months to come, however successful vaccinations. So can the ministers please be more information on medical progress with treatments? That we had a great breakthrough in Britain with a steroid helping to reduce the death rate. There are many more in trial. Can we know more about it? Are there things that people can take by way of supplements to buttress their immune system to make it less likely they get it, or are those fictions of others? Can we get better at isolating patients and suitably protecting staff in those isolation units or isolation hospitals? And why don't we use the Nightingales as COVID-19 secure and specialist units to take some of the cross-infection dangers away from some of the other district general hospitals that in that situation would not have to have the intensity of COVID-19 treatment? Can we know more about the capacity of the health service? Because there seems to be differing views on how many beds could be made available should the COVID-19 wave continue to deteriorate as it has been. And can we hear more on improving infection control? What use are we making of intensive UV under suitably controlled conditions? What have we done to try and improve cleaning of air recycling or air extraction promptly so that we reduce the exposure of people in hospitals and in other locations that we might like to use to dirty air which could spread the disease? So above all, Mr. Deputy Speaker, I think we need much more knowledge and information about the undoubted energy, I'm sure, that is going in to alternative treatments and better infection control. I'd like to thank all those in Wokingham and the area that have done so much to help us during this difficult period.
Mr. Deputy Speaker, I must respectfully disagree with a number of the previous speakers. These lockdown measures are necessary. They were necessary when they were introduced in Wales by our Welsh Government on the 20th of December, and they are necessary because of the sheer crisis that our health service currently faces. And if we needed any more information to underline that, Mr. Deputy Speaker, we only have to look at the statistics this afternoon. Over 1,000 deaths, 1,000 tragedies for families up and down this country and individuals who are no longer with us, on top of an average of 700 that we are seeing every day, people losing their lives to this terrible virus. Nobody wants lockdowns, nobody wants restrictions, but they are absolutely necessary, Mr. Deputy Speaker. And if we need any other evidence, my constituency neighbour, the member for Cardiff Central, in hospital at the moment. And this weekend I spoke and I had some heartbreaking conversations with those working in our health service, including in Cardiff. I spoke to somebody who was working in the intensive care unit at the Heath Hospital, and the stories they told me were utterly heartbreaking. And I want to say, Mr. Deputy Speaker, that my thoughts, my solidarity, my support are very much with all of those in our NHS, in Cardiff and Vale Health Board and across this country at the moment who are on the front line and dealing with the reality of this rather than some of the fantasies that we've heard today from some corners of this House. But I want to talk on two issues, Mr. Deputy Speaker, briefly. We have to offer people hope on a way out of this situation, and that is why the vaccines are so crucial. And I asked the Secretary of State for Health earlier on to give us some guarantees on scaling up the production of the vaccines as well as the distribution. In 1915, Mr. Deputy Speaker, we faced what was called the shell crisis in World War I. I know about it because my great-grandmother was recruited. She was one of 12,000 women recruited from the cotton mills of the Northwest to work in emergency factories, mixing nitroglycerin, getting that into munitions for the Western Front. A dangerous, complex, difficult manufacturing task, but one that this country turned itself to 105 years ago. And it's that kind of effort, that kind of investment in expanding facilities and adapting facilities and producing facilities, both for the production of the vaccine, its bottling and its distribution, that we need to engage in at the moment. And we need greater assurances from the government on this in the weeks ahead, not least that we know that they are doing everything that they can at a UK level to get that vaccine produced, but to give hope to our people suffering under these lockdowns and suffering with the effects of this virus. And secondly, Mr. Deputy Speaker, we must not make the mistakes that we made in previous lockdowns, and one of those has been absolutely rightly raised today by the Chair of the Home Affairs Committee, by my honourable friend the Shadow Home Secretary and others, which is about our borders. We let in people who spread COVID-19 and different strains of it around this country in January, in February, in March, in April, in May last year. We now need to have the measures in place at our borders because there are going to be more variants, there are going to be more cases coming from around the world. We need to have the best systems in place. We were told we were taking back control of our borders. We've got to have health protections at our borders, and we need those measures now.
Hear, hear. Stephen would say that Joe, love of everybody here at West.
Absolutely.
Yeah.
Absolutely.
Mr. Deputy Speaker, Mr. Deputy Speaker, supporting businesses as they endeavour to cope with COVID and its multiple challenges has rightly been amongst the government's primary priorities. A comprehensive package of support, including the job retention scheme, loans, rate holidays, cash grants, and a temporary cut in VAT for the hospitality and tourism sectors has provided a means of survival, but no more than that. And this lifeline for livelihoods must not be cut now. Particularly vulnerable are firms that depend on advertising revenue. 99% of firms in our nation are SMEs, pubs century-old, family-run hotels, cafes, and restaurant manufacturers, independent local shops. They are at the heart of our economy, and they provide the lifeblood that flows through our communities. We must ensure that COVID does not further widen existing disparities, advantaging the big at the expense of the small, advancing the national at the expense of the local, the urban to the detriment of the rural. In that respect, I repeat what I said to the Prime Minister earlier. We do need the vaccine in rural communities. It needs to be delivered locally, accessibly for those people that live a long way from large towns and cities. And for SMEs, particularly those in remote areas who face a daily struggle, they really do need continuing support. Contrast for a moment independently family-run shops, passed down through generations, struggling to cope, with a Tesco's executive rejoicing that profits continue to soar, the Amazon director celebrating a 37% increase in their earnings, compared with the owner of a much-loved bookshop, dutifully distilling and distributing the wisdom of ages, who are struggling with the strain of debt. Schumacher argued that small is beautiful, and small is indeed beautiful because people are the things that matter most. So the government must chart a new orientation, which the needs of small independent family businesses come above the interests of faceless corporations. A new challenge brings new chances for cathartic change. At present, the government is preoccupied with responding to COVID and defined by that to some degree. But we can chart a new normal, one which is fairer, which is freer, and which is fraternal, a different kind of social order where social capital matters much as economic prosperity, where the well-being of communities is the heart of all that government does. So as our redoubtable Prime Minister rightly reiterated that only through determination, perseverance and togetherness will the clouds of this storm clear, we must build a new nation, one nation based on fraternity.
West Greeting.
Thank you, Mr. Deputy Speaker. It's a pleasure to follow the right honourable gentleman. This morning, I and other local MPs met with our local NHS leaders, and it is very clear from the experience of the pressures on the NHS in my community and right up and down the country that these measures are needed for one reason and one reason alone, and that's to prevent those NHS services from being overwhelmed with catastrophic consequences for people's lives, people's families and people's communities. No one takes the imposition of these kinds of measures lightly. We do so in the national interest, and that is why we are voting with the government this evening. But there are three lessons that the government need to have learned from the last 9 months. The first is the importance of acting quickly and decisively. Being too slow to act, as the government was in the first lockdown, the second lockdown, and now the third lockdown, has had serious consequences for people's lives, people's livelihoods, and people's learning. And had the government acted more quickly, we would not have seen the excess death rates in this country, the rising levels of infection, and the disproportionate amount of lost learning amongst children and young people, not to mention the enormous economic consequences that have followed, because quick and decisive action means a more manageable set of restrictions that allow businesses to carry on trading. So we are all paying a heavy price in lives, livelihoods, and in learning. The second lesson that the government needed to have learned from this period is that public health and the economic health of our country go hand in hand. It is simply unacceptable that we haven't seen the Chancellor in this House since well before Christmas. There is a new set of national restrictions in place which are wreaking havoc with people's livelihoods. In fact, businesses before Christmas literally closed overnight at a time when they were looking forward to big Christmas trading. Where is the Chancellor? Where is the support for businesses? And where is the support for the millions of people who've been excluded since March? Thirdly, The impact on children and young people has been devastated. Schools should absolutely be the last to close and the first to reopen. But where is the national plan for laptops, for internet connections, for support for children and young people to get online? The government have had months to prepare. We urge them to act and they failed to do so. Where is the plan for exams? Warm words from the Education Secretary today, but precious little for teachers, children and young people to prepare for. So as we look to the future, and a brighter future and a post-vaccinated future for our country, let's make sure that we have a position where families can get together, where businesses can bounce back, and where we provide opportunities for young people rather than allow an entire generation to be consigned to a lost generation of widening educational inequality.
Andrew Rosendale.
Mr. Deputy Speaker, in 2017, the World Health Organization's Pandemic Influenza Risk Management Guidance emphasised that any emergency measures be necessary, reasonable and proportional. I fear the measures we are being asked to vote for today are none of these. I was elected to represent my constituents in Romford, and I pay tribute to them for their resilience throughout this pandemic. But I cannot justify such a fundamental assault on their liberties and livelihoods. Removing people's most fundamental rights and freedoms and confining them to their homes is a political decision. And those of us who are elected must judge not just the impact of the virus, but also on our constituents' livelihoods, businesses, jobs, education, homes, and indeed their physical and mental health. We are constantly told by the governing scientific and media class that we must shut down our country and that people must surrender their most basic rights and freedoms in order to save lives. Yet those countries that have followed strict lockdown strategies have not all been successful in achieving this aim. There is no member of this House that does not want to save lives. And from the bottom of my heart, I thank the NHS personnel at Queen's Hospital in Romford who have done a magnificent job in saving lives and in caring for the sick. But there has to be a balance and proportionality to these decisions, considering the long-term consequences on the lives of the people we represent. I fear the impact of these shutdowns on those who run small businesses, on the 50,000 Britons with undiagnosed cancer, as estimated by Macmillan Cancer Support, on the elderly who have been cut off from their loved ones in the last years of their lives, and on children from the poorest backgrounds who will fall behind as a result of schools closing, and the victims of increased domestic violence and suicide. The scientific advisors will never need to account for the effects of lockdown on our constituents, but we will. The shutdown we are voting on today and the effects of these measures, whilst well intended, may I fear do more damage to the lives of the British people in the long term than the pandemic itself. I believe a complete rethink of this policy must now take place. Our country cannot go on like this.
Video link. Bill Esterson.
Thank you, Mr. Deputy Speaker. Well, I want us to learn from what's happened since March rather than saying no, because if this lockdown is to be effective, we have to look at the gaps that weren't plugged so far. And I want to talk particularly about the up to 3 million self-employed people, freelancers, people who run their own businesses, people who changed jobs at the wrong time, who've had little or no financial support. It's been a burning injustice since March that they've gone without, and it continues to be. And it's something that the Chancellor should be coming to the House of Commons to describe how he is going to support these people who've been left behind. It's not fair for them, and it's an injustice. But it's damaging economically too, because they all have a contribution to make as the economy eventually recovers. And the stronger, the healthier their finances are now, the better placed they and many other businesses will be to play their part when the time comes. But there are also health consequences, because one of the characteristics of this crisis has been people haven't been able to afford to self-isolate. That's individual low-paid workers, and it's the 3 million excluded people as well. Because they haven't had support, whether it's sick pay for people who are employed, or a lack of access to furlough, or to the self-employed scheme, or often even to universal credit, people haven't been able to afford to self-isolate when they've been contacted. And that's one of the reasons, it's a big part of the reason why less than 20% of people who are supposed to self-isolate have done so far. It's something that must be fixed, because to get the health aspects and the benefits of a lockdown right, the financial side must be fixed at the same time. And that's why it's right that the expectations of the large retailers in returning £2 billion in unneeded business rate relief are that money is used to support those who've gone without so far. The Chancellor should come and tell the House and those excluded people that money will be used to support them through the coming weeks and, if necessary, months. He should be providing greater business support for those areas where business has had to go without for longer because lockdown came earlier and deeper. And he must put these things right soon, because if we don't, the ongoing crisis will be worse in the long run. The cost will be greater, and those people who've gone without will continue to suffer.
Video link. Alex Shelbrooke.
Thank you, Mr. Deputy Speaker. Mr. Deputy Speaker, I want to start by praising the Prime Minister for the way he's taken the decisions. I'd rather have a Prime Minister who leaves no stone unturned before restricting our liberties and making it the very last thing he wants to do to close schools, because ultimately these have a real effect on people's lives, and decisions we make today are with a heavy burden. I'd also like to thank the BBC for what they're going to do to help with education. That is a real public service broadcaster. I welcome the £4.6 billion being made available, and I spoke to a landlord of a pub this week, and this will be a vital injection. In fact, he's told me it's a vital injection of what can be used. But I would urge my right honourable friend, the Chancellor, to have a look at a slight extension to the rates holiday, because the hospitality sector is going to be one of the vital tools in our recovery. People are desperate to go out. And of course, every time somebody does go out, the government gets revenue because every drink sold has a duty on it. So it is one of the golden gooses of the economy. So please don't cut its head off. See if we can do more to help that industry. I do have concerns about teacher assessment for examinations. A top grade can be given to a child for what it has been taught, but there will be a lot of stuff that they haven't been taught. And I fear that they will suffer the consequences of that later on by having that lack in their knowledge. I personally would like to see exams moved to Christmas this year. This is a radical solution, but this is an unprecedented situation. Curriculum delivery, I believe, is absolutely vital, and examination is vital. Exams are not just an academic test. They're a pressure experience, a part of our human development, and that prepares us for later life. I am concerned about nurseries, and I think they will need more financial support, because many parents won't send their child to nursery if they're at home. Why would they spend the money on that? And that means nurseries could well go bankrupt, and I urge my honourable friends at the Treasury to look at that very quickly. I just want to finish on the reporting. A lot of people have asked for the number of injections that are given to be shown each day. I'm not sure that in itself is helpful. I think what would be helpful is a tracking graph of 3 weeks later, so they're then immune, and having on that graph a series of levels where it would show that when this many people have been immunised and the demographic they represent, that these are the restrictions that could be undone. And therefore, the public will be able to see how we're progressing towards the targets of being able to come out of these restrictions. And I think that gives a clearer roadmap, and that gives a clearer way of getting the proper buy-in that we need to get out of this situation as quickly as we can. It gives people hope and shows a real timeline in what it means to people. Finally, in terms of businesses who have put money aside for tax returns, and can't access that, I would urge a sort of furlough scheme for that so they could access that money and not have to pay tax on it.
John Speller.
Thank you, Mr. Deputy Speaker. And in my experience, Mr. Deputy Speaker, the Tories have never won elections because the public thought they cared, but because they believed them to be competent. Well, Black Wednesday did for John Major, and I suspect that the COVID crisis might deal with the Johnson regime. Now, nobody believes that government get it right first time, and certainly not all the time. Although that does not excuse the criminal negligence of not dealing with pandemic planning, which seems to have gone by the board. But it's the speed of reaction and the lessons learnt that's important. And the question is, why do they keep making the same mistakes time and again? Who's in charge? Who's minding the shop? Who's dealing with the detail? Ministers seem surprised at predictable events. The Prime Minister seems astonished to find out that viruses mutate. The timescale when they do, but they very certainly do mutate. And every year we have a different variant of influenza. Now, we'd already had an experience of a lack of capacity with PPE. At the time the crisis started, 1% of PPE used in the British Health Service came from this country. Stock handling was also appalling. When the crisis hit, British firms tried to make contact with the health department. They just ran into a brick wall. They were getting no response and no help. And yet the government then poured money into grossly overpaid management consultants, middlemen, and pals. Huge cost to the public purse and a real crisis in the health service. Now, with the vaccine programme, we've had this magnificent effort from the scientists with their international partners. But once again, we seem to be short of capacity. Now, the Prime Minister's response was almost acting like a Soviet planning minister, setting a target of 13.5 million people to be vaccinated by Valentine's Day, but with no clear indication of how that's going to be achieved. Secretary of State, very helpfully today, told us that it wasn't filling the glass vials that were the problem. So is it manufacturing capacity? And if so, why haven't we dealt with that in the last 12 months? Is it MHRA testing? But they've got a great record in validating the vaccines, of moving things along. Where is the problem in the system? And when we get the flow, especially of the Oxford AstraZeneca drug, because that'll be much easier to handle because of it doesn't require such a degree of refrigeration, then why aren't we talking to pharmacists, to retired doctors, nurses, and why aren't we bringing those in and getting them lined up now? Why force folk, especially older folk, to travel so far? What the public are asking is, do this lot really know what they're doing?
Video link. Kim Johnson.
Thank you, Mr. Deputy Speaker. There's been more than 2 million confirmed COVID cases in the UK, and 71,000 people have tragically died, and a staggering 1 in 5 are now diagnosed with COVID, another record high for this country. Liverpool has been significantly impacted by the pandemic, and the total number of confirmed cases in Liverpool for the last 7 days is over 3,500, an increase in over 2,300 on the previous week. This new variant poses more threat going forward, and we clearly need to take action to halt the increase, to save lives and protect the NHS. But this was not inevitable. Time and again, we have seen this government refuse to take the necessary steps to save lives and protect livelihoods. We have the second highest death rate in Europe, surpassed only by Italy. On top of that, we're currently suffering the deepest recession of any G7 country. This government has failed to rise to the challenge of this pandemic since last year, and future generations will look back on the government as having done too little, too late. Mr. Deputy Speaker, I repeat that this was not inevitable. This is what happens when those in charge disregard calls by frontline workers, teachers, scientists, unions and experts who call for schools to be closed and a national lockdown to slow the spread of this pandemic. Doctors at the Royal Liverpool Hospital in my constituency describe the situation as hanging by a thread, with major staff shortages and staff suffering exhaustion. The additional winter pressures and delayed medical demand still overdue from the first COVID wave, all adding to this pressure. Now, with hospitals at risk of being overwhelmed by this new variant, already facing this huge spike in infections with less staff than in the first wave, can the Minister outline what funding is going to be made available to bring in extra support and extra staff into the NHS over the next coming weeks? With the vaccines being rolled out as we speak, and the welcome news that AstraZeneca vaccine has been approved to begin being distributed next week, when will the government produce a national plan for vaccinations, and will they outline what steps will be taken to ensure that agency and outsourced workers in frontline jobs such as hospital porters and cleaners, teaching support staff, will be given equal access to vaccines alongside everyone else in their workplace, especially given that it is these staff that are more likely to be at greater risk of contracting the virus? Mr. Deputy Speaker, I would like to conclude by paying tribute to our valiant NHS, all workers who have continued to work to keep my city safe, the council, public health, the community and the voluntary sector, and the army of amazing volunteers. Thank you.
Thank you. The wind-ups will begin at 6:44. Video link, Ruth Edwards.
Before Christmas, Mr. Deputy Speaker, I visited Goton Primary School in Rushcliffe to see what the children had been doing in Parliament Week. Like us today, they had discussed rules and presented their ideas. I heard passionate arguments against school uniforms. I learnt about the rules in beach class, designed, like these regulations today, to stop the spread of coronavirus. Were excellent campaigns for a nature reserve, a bug hotel, and a multimedia campaign for more litter bins involving leaflets, posters, speeches, and a video. I'm thinking of trying to make some new recruits there for my next election campaign. The strong sense I left with was how happy and engaged the children were at school with their friends and their teachers. The head teacher, Jeanette Allen, and her teaching team have done an amazing job to give children back the normality that lockdown last spring had taken from them. And I know that they and schools across Rushcliffe will be working hard to provide remote learning and support to children and their families. I also know that it cannot possibly be the same. So it is with a very heavy heart that I support these regulations today. I don't believe we have any other choice given the skyrocketing rates of infection we are seeing from the new COVID variant and the pressure our hospitals are under. I congratulate the Vaccination Task Force on the amazing work they've done to develop one of the largest and most diverse vaccine portfolios in the world. Thanks to them and the incredible Oxford AstraZeneca team, the vaccine is already being rolled out at pace. I would urge the Secretary of State and the Prime Minister to continue to explore every option available, enlisting both civilian and military help for getting the vaccine out quickly, and to continue to get rid of any bureaucracy, like these ridiculous training modules on anti-terrorism for volunteer vaccinators. I'm very proud of the communities in Rushcliffe who have given their all to battling this virus. But it is taking its toll. People are tired and weary. They need clarity on the conditions that must be met for the restrictions to be eased, and on how they will be eased as we emerge from lockdown. They also need to see a clear plan of how schools will be opened up again. I would urge my right honourable friends across government to make these available sooner rather than later, to give people the morale boost they need to get through this final lockdown.
Video link. Liz Twist.
Thank you. Thank you, Mr. Deputy Speaker. And as we've just heard from the Honourable Member from Rushcliffe, lockdown does indeed take its toll on all of us. But lockdown affects some people more than others. It shifts a huge amount of risk to key workers in social care, the food and retail sector, and of course, the NHS, and to those living in deprived areas, overcrowded housing, or poverty. If we do not provide additional support to key workers and disadvantaged communities, then transmission will continue and we do not make the most effective use of this lockdown. We must make it easier for people to do the right thing and stay at home. So we need to raise statutory sick pay to a level that covers the cost of living and makes it possible for people to stay at home and keep themselves, their families, and others safe. There are many thousands of staff working for private contractors in the NHS, cleaners, porters, caterers, who currently are only entitled to receive SSP in case of illness. The government must commit to supporting these vital NHS workers in case to stay at home, protect the NHS and continue to save lives. And those working in social care take care of some of the most vulnerable in our society. They too must be able to isolate when they are ill in order to prevent spread of the virus and must be properly funded to do so. Too many people, Mr. Deputy Speaker, are excluded from the current self-isolation payment. Too many low-paid people are not eligible because they are not low-paid enough, but the loss of one income in a family, even for 10 days of self-isolation, can really undermine a family's economic stability and may lead some just to keep quiet about feeling unwell. Now, vaccines are the way out of this terrible situation, but we have to make sure that unlike the virus, which has had a disproportionate effect on the poorest and our most vulnerable, our vaccine strategy is fair and equitable. Vaccine programmes, when delivered through a call system, do not have an equal uptake across socio-economic groups, often leaving behind the most vulnerable and disadvantaged communities. So it's crucial that the strategy takes this into account and monitors uptake and engages with those groups. We know that COVID-19 doesn't hit us all in the same way. We know the devastating impact of poverty on children, and the recent COVID-19 Marmot review found that the pandemic has already widened and continues to widen existing inequalities. So the government must now continue the universal credit and working tax credit uplift of £20 per week, commit to ending the benefit cap, extend the free school meal entitlement to those whose families receive universal credit or have no recourse to public funds. Mr. Deputy Speaker, this lockdown is necessary, but it's hard. Thank you.
Video link. Tim Farron.
Well, thank you, Mr. Deputy Speaker. The restrictions that are being proposed to us this evening are rights. There is no greater freedom than the right to life, and we are willing to suspend many freedoms in order to protect those, especially those who are vulnerable, and also to protect those people working night and day in the NHS and in our care settings, protecting us. They deserve us and require us, and we owe it to them that we abide by these regulations and these rules, not least because we can now see the light at the end of the tunnel. And I'll come to that in a moment. But given that we can see the light at the end of the tunnel and the vaccination programme is now beginning, it's all the more important that the government recognises the importance of supporting the entire economy and everybody within it throughout these coming months. We now know that it is not a period of time that is going to be ill-defined and could be indefinite. We know that this will be over at some point in the next coming months. That is a source of great joy. It should focus the Chancellor, especially when it comes to the support that he needs to give it to those who are missing out. There are many of those people who have been self-employed for less than 2 years, people who are directors of very small limited companies, taxi drivers and the like, people who have been on maternity leave, who have been excluded to one degree or another from support. It is an outrage that those people have been left to get into deeper and deeper and deeper debt because the government has yet to come up with a mechanism for supporting them. They must do so, and they must do so now. They are the very people we need to build our economy back once we're out of this situation. To let them flounder in poverty now is outrageous and unacceptable. I'd also like the government to be paying attention to the need and the plight of our outdoor education centres, who are in serious danger of closure. So many of them, we may have lost more than a third of the workforce already in the last few months. There needs to be a Scotland-style direct grant support payment for those centres so we can keep them going, so they can contribute for the years to come. I'm also deeply concerned that the government should come up with a specific and properly funded strategy for dealing with the backlog in cancer. We estimate that maybe 60,000 years of life will be lost to cancer due to the coronavirus pandemic over the last few months, and it could, of course, still get worse. And finally, the vaccine, the light at the end of the tunnel, wonderful, and tributes to be paid to everyone involved in making that come to be and to administering those vaccines now, almost as we speak. But the government is making that tunnel a little bit longer than it needs to. It's very clear that supply of vaccine to places in South Cumbria is not as fulsome as it might be. There's clearly places like Sedbergh and Windermere that have not got vaccination centres set up as yet, and those sites need to be approved. I'd also want to say, as our teachers are teaching the children of key workers, that they also ought to be vaccinated as a priority.
Video link. Tim Lawton.
Thank you, Mr. Deputy Speaker, and thank you for saving me up to last. And it's difficult to say something new when you're number 67 on the list. But let me say at the outset that I recognise the seriousness of the situation, particularly with the new strain of the virus. I recognise the huge pressures on hospitals, and I pay tribute to them. But I'm just not convinced that another hurriedly announced national lockdown is the right solution, which is why I'm really loath to vote for these regulations tonight, and especially when we've had just 3 hours to debate the biggest infringement of civil liberties of our constituents that I've ever had to vote on as an MP, not least when Parliament could have been sitting all of this week and we'd have considered these regulations before they came into force, and particularly when we've seen that the sunset expiry date of these regulations has now been surreptitiously moved to the end of March rather than the end of January, as we were earlier led to believe. And when there's no impact assessment with these regulations, added to which there are measures contained in the new regulations which were brought into law in the first lockdown, but later removed or relaxed. And I said all along that government has a difficult job to balance advice and the risk from the medical experts, from the economic impact and the confidence of the public to abide by them. And after 10 months, that confidence has been sorely tested, and there's a high level of lockdown fatigue. So it's even more important that what we are asking our constituents to follow is logical, consistent and fair. And banning golf, tennis, angling and other outside pursuits was not considered to be logical and was relaxed in earlier regulations. Being banned from buying beer from off license from outside closed pubs rather than crowding into supermarkets and off licenses was also inconsistent and relaxed in early regulations. So it's frustrating and I think regressive to see these and many other unnecessary and illogical restrictions creeping back in again. And I ask the Secretary of State to be sensible and sensitive to the lobbying to remove them before it undermines confidence further. But looking ahead, my main point concerns the vaccine. It must be the single biggest imperative of the government now. We need a national effort, a little ship's effort to deliver on, buoyed up by the sea of vaccine the government wisely brought up early. So when ministers and clinicians proudly claim we'll be vaccinating 12 hours a day, 7 days a week, my reaction is, what about the other 12 hours, the other 50% of our time? We should be vaccinating 24 hours a day, 7 days a week, until everyone who qualifies is jabbed. Many volunteers have come forward to work shifts in the middle of the night. Many little old ladies in Worthing would readily bring tea and biscuits at 4 o'clock in the morning, and others to help run the technology. And if offered a jab at 4 a.m. in the morning, rather than 4 weeks hence, people will turn up. So we should be getting more juice, as the Secretary of State put it earlier, including approving the Moderna vaccine already given the go-ahead in the US, for example. Create drive-through jab centres, develop online booking slots, allowing walk-in services for spare appointments, allowing diabetics to self-jab when they get their insulin. Only when we're vaccinating full-time can the government claim to be doing absolutely everything at pace to get us out of this pandemic revolving back door, lockdown door.
Sorry, Tim. Video link. Rachel Hopkins.
Thank you, Mr. Deputy Speaker. And I want to first thank our dedicated and brilliant scientists who've given us the hope of a way out of this extremely difficult period. At the start of the first lockdown, the Prime Minister stated that the virus would be under control within 12 weeks. Yet 9-10 months on, we're rerunning the devastation caused at the inception of the crisis. The virus is spreading exponentially, many people are in hospital, and thousands of lives are at risk. This lockdown is necessary to restrict the virus spreading and to protect our NHS. And yet again, the public, my constituents in Luton South, at very short notice, are doing their bit to tackle the spread of COVID-19. But lockdown is a blunt tool. Being able to move out of it is contingent on the success of the vaccination programme across the country. So the government must ensure it carries out its side of the deal effectively by acting quickly to make sure the vaccination programme is a success. Meeting the target of vaccinating the top 4 priority groups by mid-February will require the vaccination of 2 million people a week and 14 million vaccinations in total. And while we all want the vaccine to be rolled out as quickly as possible, I'm concerned at the capacity of the UK's vaccine manufacturing to meet this target, given that the sustained lack of investment in vaccine manufacturing has left the UK acutely underprepared. The Chief Medical Officer has stated the vaccine shortage is a reality that cannot be wished away, and the government recognises this, as they've already dropped the 30 million vaccine dose target that was set in May. At the beginning of 2020, the UK did not have the capacity to produce vaccines to meet the demands of a pandemic. And so we're seeing the UK shockingly relying on repurposed infrastructure to make the Oxford vaccine. Sir John Bell stated, the government has been completely disinterested in building onshore manufacturing capacity for any of the life science products. We've also had the situation where one of the companies manufacturing the AstraZeneca vaccine in bulk is transporting vaccine doses to Germany so they can be put in vials. A decade of government austerity has hampered our ability to tackle this pandemic. And after the government's failings with PPE procurement and the outsourced test and trace system, and their failure to provide sufficient economic support, particularly to those who've been excluded, the government must now not fail in the rollout of the vaccine programme. So I hope the Minister will explain to the House how the government intends to address the frailty of the vaccine manufacturing supply chain and to rapidly increase the number of doses available. And finally, I'm also concerned that the government hasn't published a detailed strategy for the vaccination of all key workers. And as we go into another lockdown, we will once again see the real value of key workers who will keep our country going. There has not been sufficient assurances that teachers, posties, firefighters, police officers, all the other frontline key workers will be prioritised in the vaccination process. And in the Minister's closing remarks, he outlined whether there will be a
Rachel, we're going to try and
strategy for
squeeze in
vaccinating
somebody
key
else.
workers.
Video link. Richard Graham.
Mr. Speaker, thank you very much for squeezing me in. I can't think of many things I would rather not do than again restrict my constituents' lives in Gloucester. But until we've immunised those most likely to need hospital help, the responsible thing today is to support the government. And this third lockdown, it is incredibly important that we help as much as we can all those involved in distributing the vaccine to get us to the exit strategy as soon as possible. I know that the process of sharing information locally has been a real problem for some colleagues, but that's not the case in Gloucestershire, where for 9 months now, all 6 of us county MPs have met regularly with our NHS, primary care, public health and county council heads. And I pay tribute to them all, not just for the leadership that they've given to their organisations, but to the hard work of so many of their staff, both in health care, social care, and also care homes, to many of my constituents. The basic facts, however, that we are being given, we are often told are confidential. And therefore, can I ask the Health Secretary today to agree that the number of those in the top 4 categories in every area, the number vaccinated, the daily rate required to meet the February 15 goals, and the situation daily updated are basic facts that should be shared to every resident in our country. Then we can have confidence in what is happening, what the situation is, and that we're going to arrive at the destination that we need to. That will also give people confidence that there is a real exit strategy as early as possible in the spring from the lockdown so that people can go back to work as usual. Secondly, Mr. Deputy Speaker, can I just highlight that although all of us agree how important it is to get children back to school. At the moment, confidence in when pupils will be able to go back is fairly low. And one way of being able to get round this problem, even though I know it contradicts the principles of how the JSVI organises their categories, would be to vaccinate the teachers so that heads would know that all their staff would be there and won't be at risk from pupils spreading the virus inadvertently. Can I ask the Health Secretary to consider that as he considers all the other important issues about supply and distribution of vaccine as soon as possible? Thank you.
Thank you, Richard. Video link. Fleur, ignore the timer. We will stop you at 6:44, but we're pleased to squeeze you in.
Thank you very much, Mr. Deputy Speaker. I am very glad to be speaking in such an important debate. And I'd first of all like to say thank you so much to all the staff at St George's Hospital and Queen Mary's Hospital in Roehampton who are working so hard at the moment to deliver many of the life-saving care that we're talking about today in the debate. And my condolences to the over 1,000 people who have died and to their families in the last 24 hours, which really brings home why we need to have these measures, hard though they are. And so I will be voting for them and supporting them. Our hospitals are under stress. We need to have these measures to save lives and protect the NHS. I am highly disappointed about the failure of the track and trace system up to now, which I think has been part of the reason why we're having to see these continuing lockdowns, and we are not overcoming this disease as they have done in other countries. So getting to get grips with real track and real tracing back to 100 contacts each has got to be done. In terms of vaccines, I welcome this being rolled out, and I look forward to a community-first way of rolling these out in which local GPs, those who are trusted to provide and administer the vaccine, will be leading the way in this. And I really hope to see a vaccination centre in Roehampton, in my constituency especially. On economic support, I'm disappointed to see that many people are still left out of this support, and a business rates holiday will make all the difference to my constituents and businesses. And finally, scrubs. There's still a failure to contract for scrubs. There are still volunteers making scrubs for our NHS providers, and this needs to be sorted out. And I would really welcome hearing from the Minister if I can meet with those who are involved in contracting on scrubs and those experts in my community who are doing this still on a voluntary basis where it should be done nationally. So thank you very much.
Thank you for being concise as well, Fleur. Wind-ups, Alex Norris.
Thank you, Mr. Deputy Speaker, and I'd like to put on record my thanks to you and your staff for what is now the secondary call of Parliament for important business. I know that a lot of work goes into making that possible, and we really appreciate that. But it is important that we're here today. It is sobering, the daily figures that colleagues will have read whilst we've been sat during this debate. 1,041 more of our countrymen and women who have lost their lives to this horrible virus. It is a sobering moment, and with that in mind, we will support these regulations today. We don't think it's inevitable that we're in the situation that we're in, but it's clear that we are in a very challenging moment indeed. And in these dangerous times, with our NHS working at such high capacity, it is in the national interest to protect it and to make these very difficult decisions. Now, I hope people watching, if you're one of the very many people who've been excluded from government support so far, or if you've missed out on self-isolation support, or if you're concerned about business support or reductions in welfare support going forwards, I hope that from our benches you will have seen the support from Walthamstow, from Leeds East, Manchester Withington, Barnsley East, Sheffield Central, Bristol South, Sefton Central, Blaydon and Putney, all giving you voice, similarly to those very many clinically extremely vulnerable who have so often felt ignored. I hope that they saw in the contribution from the Lewisham Deptford that they are not, and the same for the frontline staff contributions made from Worsley East and Liverpool Riverside. Many points were made earlier today on schools, which I won't emphasise any further other than the contributions from Eltham, Sheffield Central, Luton North and Cambridge. And there are important points made about the border from the members from North Normanton and Cardiff South and Penarth that I will reflect on shortly. And then many colleagues on my side, Wirral West, Hartlepool, Sheffield South East, Worley, Cardiff South, all made references to the vaccine, as indeed many did on the government side. Berwick, Bridgewater, South Leicestershire, Middlesbrough South and many others, but it was particularly the contributions from the members from Winchester and Forest and Dean about the government committing to publish a schedule of precisely what vaccine they're going to receive and when, and how that's going to be rolled out. I think the government ought to do that. There are important contributions made from government benches on the exit plans and support for business, as well as children in early years, and the contributions from Cheshire and Amersham, North Somerset, Altrincham, Sale West, Poole, Bromley and Chislehurst and Woking regarding oversight. We, of course, as an opposition would support further and in shorter order review of these regulations and further debate to make sure that they are as effective as is possible. The colleagues from East Antrim, New Forest West and Romford all made points about the scientists. I would refer to, and I would perhaps fall on the Margaret Thatcher's maxim of advisors advise and ministers decide. Ultimately, if those colleagues are dissatisfied with the actions of the government, it's for those ministers alone to account for them rather than those scientists who are giving their best endeavours, even if we don't agree with them. Now, I thought it was interesting that not a single colleague mentioned that we are exactly where we were 1 week ago. Mr Deputy Speaker, I was in this place, the Minister was in her place and you were in your place, discussing regulations. That failed. And, you know, that is very funny, but actually it's not funny at all when you think about it. And I asked the Minister 3 times to say that the government thought that their final attempt to salvage the tier system would work, and I had no such commitment made, and so I don't think perhaps it's a surprise that it fell over, even if it's a surprise that it fell over as quickly as it did. And that is a characterisation of a failure to grip this virus, as my honourable friend from Ilford North said, just so slow and always short, trying to do the bare minimum and never frankly doing enough. And it was, again, in a similar vein, I think, quite disappointing that the Secretary of State's contribution, his 23 minutes, could have been an intro to a general debate on vaccines, because that's all he spoke about. And of course the vaccine is important and is our way through this, but actually it's a failure to grip at a ministerial level that there are many other things other than the vaccine that they have control and say over and simply have not done well enough on. But this lockdown that we will no doubt support tonight will not make our problems go away. Lockdowns don't solve anything. They buy you time to solve things. So in my limited time remaining, I will highlight some of those that I think the Secretary of State ought to have referred to, and I hope that the Minister will too in her winding up. On economic support, again, not a word for those many millions excluded from support so far. They have gone a long time now without support. They deserve more than the glib comment they had from the Prime Minister this morning. I hope the Minister might do a little bit better. The Chancellor should be here, giving us a chance to scrutinise those plans. He was very keen to at the beginning, but we've not seen him now for a very long time. On test, trace and isolate, it remains the significant gap in our fence. You know, what fools we all look now that when the virus was at its lowest ebb in the summer, that system was not sorted out. And instead, you know, whilst the testing number at the beginning of the system remains a very good one, turnaround time doesn't hit its targets, tracing never hits its targets, and we know that not enough people isolate because the support for them is not good enough. The fact that we've failed to fix those problems, I think, reflects very poorly on the government. On the border, now I'm always loath to make international comparisons, certainly beyond Europe, but our daily death total today is more than the entire death total during this pandemic in Australia. And there are ways in which we're similar, ways in which we're different to them. But I think we should reflect that on the 20th of March, they closed their border. And that for anyone returning home during that time, they had a 2-week quarantine. But other than that, that was it. We're now still talking about test and release and other such measures at the border. It's an extraordinary failure. And just to make a couple of points on the vaccination to finish, you know, the vaccine and its procurement and its development has been a success, this government, and you know, I've said that multiple times from this place and will continue to do so. Whether they have a successful vaccination programme remains to be seen. And you know, there is frustration, I think, across both sides of the House that there isn't yet a sense that this is going to be a 24/7 service, that we're unleashing all those people who want to volunteer to contribute. I think it's very surprising to see pharmacy on the front page of national newspapers. That's the length that pharmacies feel they're having to go to get the attention of the government. You know, if the government are sure that they don't need this extra support and that they're still going to deliver on time, I think they should be clear about that. And I'd like particular clarity from the Minister. We keep hearing the Secretary of State and the Prime Minister, they've changed their form of words in the last 3 or 4 days to now saying that everyone in categories 1 to 4 will be offered the vaccine by the middle of February. What does that mean? What does that mean in terms of the modelling? Before, we thought that by the middle of February we wanted everyone in those categories to be vaccinated within obviously the limits, of course, of people not choosing not to take it up. But what that cannot be is a paper exercise. It has to be the fullest effort. Well, the minister seems to dispute this, so I hope she will take her time and contribution to do so. Because actually the vaccination programme represents a deal between the British people. We're asking the British people now for a significant period of time to endure significant hardship. And that's the British people's side of the bargain. The government's side of the bargain is an effective, safe and timely vaccination programme. They have to deliver on that. And I'll finish in that spirit with a simple message to my constituents and to constituents across the country. Stay at home, protect the NHS, vaccinate Britain. Thank you, Mr Deputy Speaker.
Minister.
Thank you, Mr Deputy Speaker. The regulations before us today set out measures that none of us want to take. Yet they are measures that we must take if we're to control this new and aggressively infectious variant of coronavirus, which is spreading rapidly across the country. As we've heard from the Prime Minister and the Secretary of State for Health earlier today, we are up against it in a race of vaccine versus virus. We are vaccinating faster than any other comparable country, but even as we do so, we also have a relentless rise in the number of new infections each day, hospital admissions and, sadly, deaths. We now have over 30,000 people in our hospitals with COVID. And earlier this week, the UK's chief medical officers advised that we should move to alert level 5, meaning that if action is not taken, NHS capacity may be overwhelmed within 21 days. The consequences of that and the decisions that it could lead to are not decisions we want our doctors to have to take. And therefore, I say to honourable members, that is why we must adopt the measures before us today. But of course, just as we don't want to impose these restrictions on people, we must be ready to lift them too, as soon as we are in a position to do so. Because we know lockdowns come at huge cost, economic, social, and particularly to the many thousands of children who are no longer going to school.
My honourable friend,
I will indeed give right on.
These regulations can continue until the 31st of March, but can my honourable friend confirm that in fact these will be reviewed fortnightly and any regulations that are considered unnecessary will be lifted as soon as possible?
Well, I thank my honourable friend for his intervention there. And in fact, many other honourable members have also asked today about the duration of the restrictions and about ongoing parliamentary scrutiny. And I can say that the regulations provide for these restrictions until the 31st of March 2021, not because we expect the full national lockdown to continue until then, but to allow a steady, controlled and evidence-led move down through the tiers on a local basis. And the restrictions will, of course, be kept under continuous review. We have a statutory requirement to review them every 2 weeks and a legal obligation to remove them when they are no longer necessary to control the virus. And I can reassure my honourable friend, also the right honourable friend for Altrincham and Sale West, for Cheshire and Amersham and for the Forest of Dean and others, we absolutely do not want to continue these restrictions longer than is necessary. Most particularly, we do not want to keep children at home and being homeschooled. And I say that as a parent right now with 3 children who have spent the day, I hope, being homeschooled. My husband has been in charge of that today, but we don't want that to be the situation any longer than we have to. Schools were the last to close, and the Prime Minister has said we want them to be the first to open. Of course, they are still open for children of critical workers. And I just want to pick up on a point from my honourable friend for Bridgewater and West Somerset. That should include those involved in the construction of critical national infrastructure, such, I believe, as the Hinkley Point Power Station. While with great reluctance we have had to keep most children out of school, we have also had to require outdoor sports facilities, such as golf courses, to close. Mr Deputy Speaker, several honourable members have challenged this, and I want to tackle it head on. And I say to honourable members who've raised this, if you make an exemption for golf, you have to make an exemption for other outdoor activities, tennis, for instance, outdoor bowling, climbing walls, riding centres, dry ski slopes, go-karting. I could go on, but people would then say to you, I'm being told to stay at home, but I can go and do all those things, so you don't really mean I should stay at home. So quite apart from the fact that even in, one moment, quite apart from the fact that even in those outdoor settings people congregate, we actually do need to be really clear that the message now is stay at home.
I'm lost. I mean, I'm pretty thick when it comes to logic. So you can go on your bicycle and that's exercise, but you can't go and sit on a riverbank on your own in a solitary way. What is the problem with that?
I don't believe that my honourable friend is as he describes himself, but what I do think is quite clear is that we are saying to people stay at home, except for a very clear list of essential reasons why you can leave home, for instance, such as children who are eligible as children of critical workers to be in school for healthcare appointments and indeed to exercise. But we really do need to make sure it is absolutely clear that people should, other than those specific reasons, stay at home, because that is what we need to do in order to control this raging virus. And that is the message that all of us need to convey to our constituents. I will just try, I've got very little time, so I want to cover a couple more of the points that may have been raised, including ones raised by my right honourable friend. As honourable members have referred to, this national lockdown is different to previous lockdowns because we have the vaccination and the end of this is in sight. We've already vaccinated over 1.3 million people, including nearly 1 in 4 of those over 80 who've had their first jab. And by the middle of February, we expect to have offered the first vaccine dose to everyone in the top 4 priority groups identified by the JCVI, care home residents and staff, people over 70, all frontline NHS and care staff and the clinically extremely vulnerable. And that answers the question posed by the Shadow Health Secretary as to when NHS frontline staff will have had the opportunity to be vaccinated, as they, together with social care staff, are in the groups to be offered the vaccination by mid-February. The member on the front bench opposite asked about this point about offered, and he will know that vaccination is not something that is mandatory. We are educating, encouraging, informing people of the important reasons why they should step forward and have the vaccination, and that is the way that we are going about it. My honourable friend for Middlesbrough South rightly said that we should stop at nothing to get people vaccinated, and I could not agree more. That is why my honourable friend, the Vaccination Deployment Minister, is working with the NHS and getting millions of people vaccinated in just a matter of weeks, involving hospitals, GPs, community pharmacies and a workforce that includes thousands of volunteers, including health professionals, returning to the front line to play their part. And as the Health Secretary confirmed earlier, we've already acted to reduce some of the bureaucracy and particularly some of the training modules which was being required for those NHS returners. So we are ready to vaccinate just as fast as the vaccine can be supplied. I have heard several honourable members call for more data on the vaccination rollout, and I can assure them we will see the publication of weekly data tomorrow, and daily data publication will start next week. And that data will show our accelerating vaccination programme, protecting more people day by day, so that in time we will be able to lift many of the restrictions that are before the House today. So in conclusion, Mr Deputy Speaker, we do have some difficult weeks ahead for all of us, and especially for those at the front line working in health and social care, who we cannot thank enough. But we are now in the final stretch with the end in sight, so we must keep our resolve, get behind these restrictions that are needed to control the virus until the vaccine has reached those that it needs to. And I commend these regulations to the House.
The question is motion number 3 relating to public health as on the order paper. As many as have done it, say aye. Aye. The contrary, no. No. Division, clear the lobby.
monitor them and make sure the room is right.
Yes, I mean, yes.
Order. The question is motion number 3 relating to public health is on the order paper. As many as of that opinion say aye. Aye. Of the contrary, no.
No.
Tell us for the ayes, Maggie Troop and Tom Pursglove. Tell us for the noes, Christopher Chope and Christopher Green. Lock the doors. Order, order.
The ayes to the right, 524. The noes to the left, 16.
The ayes to the right, 524. The noes to the left, 16. So the ayes have it. The ayes have it. Unlock.
I beg to move that this House do now adjourn.
The question is that this House do now adjourn. As many as that can say aye.
Aye.
No, I think the ayes have it. The ayes have it. Order. Order.